Okay, good morning. My name is Tyler Monroe with Thomas Saffer and Associates, one of the members of the principal developer team. We're delighted to be here this morning to provide an update on the principal developer's work over the last quarter here on campus. I'm joined by my two colleagues, Oscar Alvarado with Century Housing, Beth Banco with US Vets. Together we'll give you an update where things stand and take questions. Next slide, please. I'm able to control. Okay, so starting off, just give an update briefly on building 207. Just a reminder, it's an adaptive reuse project for senior veterans. There's 60 units, 59 for veterans, one manager's unit. All units are at 30% of the area median income on this project, but I know that's the topic of current conversation that's been going on for the last day or so, and therefore before then, we're working with the VA on a few other solutions as it relates to that AMI level. But let me talk a little bit more. We can get to that later. But let me kind of give an update. That's where we are with construction. Next slide. Am I able to look at slides, or am I asking for folks to do it? Next slide, please. This quarter, we started tenant matching, or beginning the tenant matching process later this quarter with the VA and our CES partners. We're still tracking for a substantial completion of construction, and at the end of this year, we've had a few supply chain disruptions, specifically our elevator and delivery of power, but we believe we've resolved those. So we think the elevator will be here in the next week or so, and power will be turned on at the beginning of November. We also received word from Southern California Gas just yesterday that our gas meter has been released to bring gas for hot water. We expect that in the next week or two to be able to start bringing final utilities into the project. I'll show some photos on subsequent slides, but all finishes are in process on inside the units. On the second and third floor, countertops are in, finished plumbing is in, final paint is complete, flooring is in, all the appliances have been delivered and installed, and we're working on off-site sidewalks and landscaping right now at the moment. And we're all working really hard to wrap up by the end of the year to be in time for initial tenant occupancy at the beginning of next year, first quarter of 2023. Next slide, please. Maybe I'll have Tess speak a little bit to our lease-up plan.
Hi, good morning, everybody. It's great to join you again. I'm Tess Banco. I work in two different capacities. One is with TDC as the Community Development Director, and the other is with US Vets as the services provider, lead service provider that will be providing services to the North Campus in conjunction with other services teams. So here on the lease up and move-in plan, units, as you heard yesterday, will be built in conjunction with the LASA CES, with SERS and HUD-VASH. So I know you all got a pretty thorough overview of what that looks like yesterday in terms of how that's going to be moving along and the details of that. So TSA's team, services team, is meeting with the lead service provider, of course, US Vets, SERS, property management companies, other service providers from other developer teams. So what we're trying to do is all be on the same page and move together as the buildings open up. It just so happens that 205 and 208 are opening around the same time. So we're working in conjunction with them to determine things like if welcome home baskets are needed, or what types of different supportive services US Vets can provide in conjunction with whatever's being planned for the individual buildings. So we're meeting every other week during the lease-up process. So this has been going on actually for the last 6 months. We've been looking at how everything fits together in the services package. So listed here again, US Vets and HUD-VASH responsible for case management, which you heard yesterday. So the details of the services plan, 2 VA HUD-VASH case managers. Around that will be US Vets wraparound services. So we're hiring a veteran supportive services coordinator for wraparound and evening services, so that there's continuity, so that when the HUD-VASH case management goes home, or perhaps there's an absence, there's someone there always to continue to serve the veteran and be there in case of questions, and also during after hours, which I know is a concern. So other supportive services being incorporated. We are hiring for a veteran outreach coordinator, and I think that's a really important position for wayfinding and support. And that outreach coordinator will also work in conjunction with the by name list that you heard Maggie talk about yesterday. So that outreach coordinator will be part of that team, helping veterans make it through the application process, in case they have a HUD-VASH package that is not yet completed, or they need to find documentation or items like that. So it really is support to help veterans get where they need to go in terms of getting into housing. We also are having programmatic support from US Vets. So as you know, US Vets is the largest service providers for veterans in the nation, and there's a lot of really great programming that goes along with that. So those include things like Women Vets on Point, specialized women's services, peer support services that we'll be doing in conjunction with LA County VCAN Veteran Care Access Network, which you probably heard a little bit about yesterday, career development initiative and workforce initiative. So of course, finding meaningful employment, helping with that process. And then also Outside the Wire, which is a program for college students and those that are approaching the educational system. And that also includes psychological services, case management, and those types of things. So there's a wide breadth and depth of supportive services for different priority populations that are moving into building. In addition to that, we are also working with aging programming. So services specifically for those in building 207. And we're doing that in conjunction with VA sections like geriatrics and SIRS as well. Coordination with VA section services, I get a little bit ahead of myself, but yes, I'm working very, very closely in conjunction with VA sections and services across that whole spectrum of services, supportive services package. And that's not just for the housing unit case management, because each individual housing unit, as you know, will have case management attached to it, and then also wraparound services. But that's also for the wider regional services that we're already providing before Building 300 comes online. So there's a package of services that we're working towards bringing online, but before that even happens, we're already providing services on the ground to veterans and their families through the US Vets programs, and then also connecting them. So the wayfinding becomes very, very important. In conjunction, there's also coordination with other partner service providers to ensure a gapless and full range of services. So as you know, Building 300 will have a range of different service providers. Again, VPAN, yesterday we talked a little bit about the Maslow hierarchy of needs. So Building 300 really is intended to encompass that hierarchy, starting from things like food. So the food bank we've already talked to will be in the building, Building 300. And we're already planning with them before the building opens up, as I mentioned. There will be things like barber and beauty in Building 300. There will be teaching kitchen, so of course employment services, classes, the full range of things that individuals would need as they are coming into housing, permanent supportive housing, and beyond. In addition to that, in the wider community, the campus community, we're really working hard to ensure that services and support are gapless. One of the things that's really interesting to me is that suicide prevention, in that realm, there are two different factors that they point to. One of those is being a burden, and the other one is a lack of belongingness in the community. So as we're building this community out, what's really important to us is building a community where people feel like they belong. And we're building in structures on the macro level, aside, just from the housing unit services, that help veterans feel empowered to take part in the community. Resident council, the town hall, Building 13 is a couple years off, but already setting the wheels in motion to have that programming in place. So the resident council, holding town halls regularly, getting information out, organizing around the different collective impact pieces. So measurement of our goals, working to bring the backbone online. So the backbone will encompass a partner and provider alliance that we're working in conjunction with VA to bring to fruition. And that will be working with all the different service providers on campus, again, just organizing, coordinating amongst not only the more micro level services like HUD-VASH case management, but also the macro level to build a community that really is a place where veterans and their families can flourish. So again, with that attention to the different priority populations, veterans, aging veterans, veteran families, and those different groups. So that's what I have, and I'll hand it back over.
Slide, please. Here's just a couple photos of the inside and outside of Building 207. You can see in the upper left-hand corner, the appliances are in, countertops, plumbing finish, electrical finish. And then the bottom right-hand corner, the same idea, all the cabinets are installed, countertops are complete, sinks, and the plumbing fixtures are all installed, obviously the windows are in, and then the middle photo on the top just is an example of landscaping that's being wrapped up. This is specifically hardscape and the sidewalks that are being finished up along Arnold and Vandergrift and along Bonsall. And then the grading in the bottom left is just preparation for landscape work that's now ongoing. Next slide, please. Building 402, so we're on track. This project has an allocation of low-income housing tax credits and tax-exempt bonds, in addition to funding support, project-based batch vouchers from the County of Los Angeles, charitable contributions. We are on track to close construction financing and get shovels in the ground by the end of the year and get shovels in the ground in the early part of next year. This project is non-age restricted. It has 120 units, has 2 managers units, and 118 units for our veterans. Half of these units, this is an example of lessons learned as we're discussing the AMI thresholds. Half of these units are at 30%, but half of them are at 50% of area median income. So, as mentioned earlier, 207 had 100% of units are currently at 30% AMI. Obviously, plans are in the works to make some changes there. But here we have units that are at 50% AMI. So those veterans that are receiving service disability payments that cause them to exceed the 30% AMI threshold can absolutely be housed here. We're obviously open to further feedback on it. Obviously, we want to collect more data to make sure we're capturing the biggest and broadest population that we want to serve here. But I just want to point out that both this project and Oscar will speak to it at 404 have AMI thresholds well above 30% AMI and 50%. So we're saying that the tax credit program in the state of California actually allows average AMI at 60% AMI with total AMIs up to 80% AMI as long as you meet the average of 60% under income averaging. So it's something to be considered. It's a long-term solution as it relates to veterans that are receiving disability payments and other forms of income to ensure that we're able to serve everyone that we want to serve. Next slide, please. As I mentioned, anticipated start of construction at the beginning of next year. We're currently in the closing process right now with VA, with OAM, GLA team, as well as our investors at Wells Fargo and our lenders at the California Community Reinvestment Corporation. The County of Los Angeles is a major partner. They've been terrific in our plan check process, working through a lot of the various technical issues around construction, provision of utilities, whatnot. Anticipate a substantial completion of this project in 2025. It's about a 2-year construction timeline, and then tenant occupancy at the around the same time. Next slide, please. I'll hand it off to my colleague Oscar here.
Thanks, Tyler. Good morning, everyone. Oscar Alvarado with Century Housing, and I'm just going to provide all of you with an update on Building 404, which is Century Housing's first development here on campus. Much like Building 402, which you just heard about, Building 404 is getting teed up and ready to start construction. We expect to close our construction financing on 404 in the next couple of weeks and to break ground in the month of December. So we're really excited about doing that. 404 is a new construction project being constructed over parking lot 48 that includes 73 apartments, 72 apartments for our veterans, plus a manager's unit. Again, we're looking to break ground in this coming month and to complete construction by the end of 2024. Like Tyler mentioned, this project has a mix of AMI levels, providing both for veterans at 30% AMI and 50% of the AMI. And next slide, please. That's all that we had for this morning, so we're happy to take your questions. Mr. McDonald.
Well, I was going to add one thing before. I was going to add one more thing before we wrapped up. And I was remiss in saying that the VA has completed nearly $10 million of site preparation work on both parking lots 38 and 48 as part of the turnover process. There's been a lot of collaboration that's been going on to remove solar photovoltaic arrays, relocate water lines, build new water lines, relocate other utilities in order to make this happen. So that's something that's been wrapped up, nearly substantially completed at this point. So Alan's not here, but he's leading the charge on the VA side for that. We're grateful for all that work that's already been done. So thank you.
Philip Mangano for the record. So first of all, thanks so much for this update. It's very helpful to see progress. It's especially helpful to see the timelines in that much of our discussion yesterday had to do with timelines and the capacity to deliver tenants to ongoing projects. So even right now, as we sit here, as you probably know, there are dedicated units to veterans which are unoccupied by virtue of a stream of referrals. I'm incapable of keeping up with the unit. So to that end, I wanted to look at building 207 because that's the first one coming up. That's one focused on veterans. So as I understand it, and help you with this, the timeline is that you will finish all of the construction. The building will be ready for occupancy in the first quarter of next year.
Correct.
And so I'm wondering, are there already veterans targeted to those units in terms of the work that you've been doing? Some of the discussion yesterday talked about it taking 120 days between the time a veteran is identified and the time that they could actually move in. So, you know, as we add up 120 days, that's just about when you're about ready to open. So I'm wondering, has there been an identification of veterans for building 207?
Let me ask Angela, she's been more close to the
Of course.
selection process.
Thank you. As you know from the presentations yesterday, it's a rather complex process with different organizations working together to bring it to fruition. So far we have been working concertedly with VA in the ramp up and the tenant selection process, and that is already in motion. So the teams are already meeting directly with LASA, and that has started already. And one thing that I know working in conjunction with VA section, working in conjunction with SERS, is that they're committed to getting that process completed as quickly as possible. So the timeline that we were given was the upwards of what you had said, and then also 90 days. So anywhere between that, but trying as quickly as possible to get ramp up and tenant selection complete.
I appreciate that. The sense I think most of us had from yesterday was that it would be very difficult to identify all the veterans who would be moving in. So I think we anticipate that. Obviously, you're not going to open the doors and have, I guess, 60 in this building?
Correct, 59.
You're not going to have 60 people waiting at the front door to go in. So just thinking about that reality, what would you anticipate the rate of occupancy being, say on a per week basis to get to the 60, understanding that we don't have a targeted system right now in terms of identifying veterans. We don't have a mechanism by which the timeline could be speeded up a great deal. We don't have those in place. I'm just wondering, realistically thinking about opening, ready to open in the first quarter, what do we really think the time frame will be in terms of occupying the units? Maybe on a per week basis, how many do you anticipate going in?
It'll depend on the process here with the VA, with CERT, with LASA. I will say outside of the VA campus, the typical timeline is on a furnace supported housing is about 15 to 20 units a month. And it's about 20 to 25 units a month for non-supported housing units. So that we're typically looking at anywhere from 2 to 4 months to complete a lease up for any kind of project in the 60 to 100 unit range. And that's typically what happens. In order to go through the full referral process and bring them all in and complete all the paperwork, it's taking about 15 to 20 months is what we're seeing on a lot of other projects right now in LA County, working with LASA.
To be clear, we're not holding you responsible on this issue. Again, there are a number, including the housing authorities here in Los Angeles, both of them, and other provider agencies who have vacant units who are begging for referrals and not receiving the referrals they need to provide capacity, which impacts, of course, on the finances of the project and all else. So I think our sense is that having a realistic projection of what will take place will help all of us, both in terms of obviously veterans who are waiting for housing, your finances, and just having, again, a better and more realistic idea of what will happen going forward. So would you anticipate that, say, within the first 2 months, so that would be 8 weeks from the time you're ready to go, then you would have this filled.
I don't know that 8 weeks necessarily. I think we're all committed to doing it as fast as possible, but also making sure that we're serving who needs to be served. We've anticipated part of our financing a 3-month total lease-up timeline in order to give ourselves enough time to go through the referral process. That's what we assumed and what we projected. Now, if we can do it faster, and obviously we're working through the system right now in 207 as the principal developer the first time. So we're still trying to iron all those things out, and those have been in the works for quite a few months. So a lot of collaboration is going on. There's bi-weekly meetings. Those meetings are now increasing to weekly. There's conversations that are going on between VA, CERS, LASA on an almost daily basis to try to figure out how to best accomplish the lease-up process on an expedited basis.
So you do have other developments that are targeted to homeless veterans?
I'm sorry,
Do you have other developments that are targeted to homeless veterans?
not specifically homeless veterans. We have others that are specifically to homeless youth, to homeless families, and to homeless seniors in LA County.
Keith, I'm wondering if you could just shed some light on this, because I know you're involved in creating a process whereby veterans would be identified. What do you think would be a realistic anticipation for the filling of these 60 units in a project that would be completed in the first quarter of next year?
Peter, I actually don't feel equipped to give you a realistic time frame. I'd be inclined to follow the developer's experience and expertise on it.
So, I mean, that's a hard thing to swallow, of course. The idea that there are vacant units now, we're creating more units. These folks are putting their resources on the line, and yet there's no expectation even. We can't say that there's an expectation that these units will be filled in the first 2 months of it being open. I mean, it's just left in the ethereal anticipation.
Keith Harris again, no, I wouldn't have framed it that way. What I heard was someone with experience filling new buildings, giving us a realistic sense of that time frame, and I'm inclined to follow that. I can say we feel every bit of urgency that you do and that everyone else in this room does. There are pieces of this process that are not 100% worked out yet. Those conversations are going on right now this week that'll also influence that time frame. That's the reason I'm hesitant to give you any other time frame than what we're hearing here.
I mean, the potential mothballing of units, which are already being mothballed at both housing authorities and other developers. And I'll be asking every developer that presents today if they have other units that are available to homeless veterans and if all of those units are filled. And one more question before Josh. If there were a constant flow of referrals, what would you anticipate in terms of the filling of these units? How many per week would you anticipate? If there were a stream of referrals, how long do you think it would take to fill this? Maybe.
We can fill in the grade of 1 a day, 1 plus a day. We could get 30 plus a day. I think going more than a day, 1 a day is tough.
Sure.
But possibly 1 a day is probably a reasonable time frame.
Which would be about.
It is constant flow, but we're just not seeing it. And it's not just in any project, it's just difficult to get 1 a day referred in every single day.
And at that rate, it would take about 2 months to
Right.
fill. Yeah. Great. Thank you. Thanks so much.
Dr. Bender. Can I add one thing, Steve, please? So we, in a project of this size, we have a project about this size in Riverside. It took us 4 months to build it. Bringing veterans in, not only doing the paperwork, but engaging them in the community. So you don't want to put 20 veterans in a week in there because you simply can't serve that many. So that ramp-up process, and Tyler's exactly right. Our typical intake is about 6 a week, 6 to 7 a week. And we have a waiting list. So even though we have a waiting list, we can't bring them in all at once. We need to engage in the community, do the paperwork on them, make sure we understand who's in our units, 'cause that's gonna be critical, that we know who's in our units so that we can serve them appropriately.
And Steve, do you have the waiting list where?
We always create a waiting list before, so who is eligible for this building? So we'll have that waiting list waiting, some of those are gonna disappear if they're homeless, but we'll have a waiting list, ready to go, once we're ready to bring people
And
in.
you anticipate that for building 207?
Yes,
So your concern isn't so much filling it, so even though in Los Angeles, what we've heard is that there are vacant units.
Yeah.
You anticipate it will not be difficult to fill these 60 units?
I don't think so. I think there's a lot of, veterans who are gonna wanna be here. And I understand that there are empty units. I just don't think we'll have that problem.
And so, in your experience, I'm sorry, Josh, in your experience, what would a weekly enrollment, or establishment of tenancies, how would that roll out on this project, assuming that you have the kind of waiting list that you have spoken of?
It's traditionally been about 6 a week.
6 a week?
Yeah.
So it's about,
And that's, as I said, due to the fact that we're gonna get to know every veteran, don't wanna bring a crowd in and just send them up to the room. We really want to engage with them, engage them in the community, make sure that they know who their social worker is, so that we're creating a cohesive community.
well, I appreciate that. Again, with the background of yesterday's conversation about units that are vacant for veterans, I think we have concern on any project, not just this project, but any project that's moving forward. So it does get back to the referral issue, and our hope is that with some of the enthusiasm we saw yesterday, that issue will begin to be addressed in a more expedited way.
Yeah, we're working for that.
Yeah, thanks for your good work. Josh?
Good morning, Josh Bamberger for the record, and Ian, thank you. And, when we were here last time, we got to see the incredible quality of the architecture that you're developing, and it's going to be a wonderful home for many veterans. Very exciting. Tess, I want to learn more about the services plan. So one thing that we've been hearing about is that there's going to be HUD VASH, case managers / social workers, and US vets, case managers, social workers, and then there's the property managers, who I assume are going to be employed by TSA. So can you talk about the different functions of these different employees? Is it going to be clear to each veteran as to the differences of the roles? Is there going to be a differences of the roles, and so forth? Dig in a little bit to the services plan, please.
Sure, I think simply by the fact that there are two different sets of case managers, so you have the HUD VASH and then you have the after hours case management, there is going to be a delineation, which we'll have to very carefully approach. One of the things that I like to pay attention to and we need to pay attention to here is the gaps and cracks between when somebody goes off shift and then another caseworker comes on. I think that's a really important point at which, veterans can have challenges getting connected to their HUD VASH case manager, or, vice versa, which we work very hard to prevent, but it certainly is a place where, because there are two different teams, it can be a challenge.
So is the HUD VASH workers only they're 8 to 5 or whatever, and then the US vets, give me the right term, case managers, what do you call them? Are there after and there's no time when all of them are together during the day?
I anticipate there will be some overlap, and then also case conferencing does occur for veterans in the building. So there's really some information that's signed. They're able to work together to try to bridge, whatever gaps might exist, and also get the right services package. So individualized service plans are created for the veterans that are then worked on by both sets of case management.
Yeah. So sort of late breaking news, we are, for the record, John Kuhn, Acting Deputy Medical Center Director. We are planning to contract out all these services at these buildings. So the HUD VASH team will be making referrals perhaps, or our medical center will be making referrals. But we certainly recognize the potential value of a single provider in a building. We can't promise that's what is happening, but we can say we are contracting out the services.
excellent news. Thank you so much for that.
Do we, who? Who is, there's no who yet, it's a, you have RFP here. Okay. That's interesting.
It makes sense.
Yeah.
It's astonishing.
All right, I'll go on to other things. So, a couple of things. Thank you for coming up to San Francisco and seeing our program. Any idea how you're going to integrate medical services into these buildings? Have you made that ask of the VA to have an on-site nurse or rotating a mobile team that can come into the building to assist people to adhere to medications, to assess their medical condition, get them to the hospitals?
We certainly are collaborating on that, and we have spoken to VA about implementing and incorporating the medical model services, including holding space for potentially having these services within Building 300, which is the Integrated Wellbeing Center, and then also how we will get the services for the aging veterans, particularly. If that will be services that come into Building 207 and are provided there, so like the nursing, geriatrics department, those types of things, or how we can facilitate veterans who have appointments down at Building 500, being able to easily travel between the two. So that's under discussion right now, but rest assured that it is a very important point.
So what I hear you saying, tell me if I get this right, is there may be a medical team, nurses, nurse practitioners, med techs, who have their office at Building 300, who could potentially be available for all of the different buildings? And have you made that specific formal ask? And is there a budgetary line within the VA budget that will be in process so that you will have the money available and the staff by the time the building opens at the beginning of January?
I would be completely remiss to speak on something that's not fully baked. But yes, that is the vision, to incorporate these services directly. And it's under discussion currently in terms of what can be done and how we can achieve that together.
Great, and I'd love to hear more about that model, and then the important tension that happens between property management and support services, so that support services is advocating strongly for the well-being of each individual, and we don't know what they're going to be, but let's assume it's contract agency go through. How are you planning on having a good firewall between property management and support services? What experiences you've had down at Cabrillo and so on that you can describe how that works in your model, so that both the building's well-being is being adhered to, so people like Jim Burley who want to, have this building healthy, and then people like me who want to have individuals healthy. How are you going to have that healthy tension? Where are you drawing your model?
Sure. I mean, we started working together, not just with the services teams, but property management teams, as I said, 6 months ago. So really gelling and looking at the different subject matters and ways that we work together has been very important. And I find that there's a lot of cohesiveness, and also we have things like the Housing Retention Action Plan that both property management and services teams work together in order to help keep the veterans who become housed. So there's a lot of coordination going on around that, bringing those two different teams together, and then also agreeing on, the types of things that will happen if there is a challenge within the housing. So, if a veteran does have a challenge, how is that approached? And again, we're all pretty much on the same page, and then also working with other developers as much as we can in order to have kind of a cohesive idea of how property management and services function together.
Great. I just want to say for the record, 2 months before buildings opening, 2 months delayed, having so many of the components of the core functions of servicing permanent supportive housing unknown makes me anxious. And I'm living in San Francisco, so I imagine you all, this is late. This is really late. And the training necessary, the hiring, this is late. So, and the goal is to serve some of the hardest to serve seniors who are homeless veterans in the area. This is late. So that's not a question, just a statement. And then my last question, which is perhaps a particular issue for me, bed bugs. Do you have a plan to be sure that no veterans are bringing in belongings that are going to create bed bugs in your beautiful building?
There's a bed bug protocol. So again, working with all the different services teams and property management teams, always been a little bit of a process. Essentially what we did was go through everybody's documents, their guiding documents, and we came together and ratified property management standards. So joint property management standards And bed bug protocol was on there, so yes, there's absolutely a protocol.
I mean, what we use dogs. We freeze people's stuff. We have one building that we rented up quickly. We had a freezer truck and people would put all their belongings in the freezer for 24 hours and that eradicated the bed bugs. Can be an enormous expense and can slow down rent up dramatically when one person comes in early on. So I encourage you to think that through thoroughly and to have a very solid plan.
Thank you so much for, what I really appreciate is that you raise things that otherwise might go untalked about. So, and again, thank you for having our team out in San Francisco. It's really eye-opening.
Thanks.
Mr. Van Duzer.
Sure, thank you. Thank you. This is Sean Vandiver, for the record. I couldn't agree more with Dr. Bamberger. I think we're way behind. I also am really concerned that, well, first, I recognize what a big undertaking this is, but it's not like this is a surprise to us, right? Like we've known this has been coming for a long time. Which is why I think that one move in a day is, these are big buildings, right? I think one move in a day does not seem like a success to me when there are veterans who are living in tiny homes that are catching on fire. And a lot of vulnerable people who have made their voices heard to us and told us how desperate they are to get in here. We know that they would get in here. So I guess I just don't understand why we can't figure out how to get a list ahead of time. Like, do we have to wait until it's open? And I would encourage folks to, whoever is responsible, to figure out how to get more than one veteran a day in there, maybe 3, maybe 6. There's a bunch of different college campuses here. There's a bunch of different, we all served in the military. These folks all served in the military, and imagine if boot camp took one person a day to move this. I did like, and I know the population is a little bit more challenging than that, but like, I don't know how anybody can seriously come here and tell us like, well, the best practice is one a day. Because that's just, I can't imagine how the veterans out in those tiny homes feel hearing that it's going to take several months and we can't figure out who's going to be able to move in. So I hope that we can get a better answer than that. And I hope you don't expect anybody to stand behind you. You can't get a better answer than that. I don't have any questions.
Dr. Bamberger.
Josh Bamberger for the record. Another thing, as you talked about the outreach worker. So can you flesh out a little bit more about how that works? So, for example, we're renting up a bunch of buildings this week in San Francisco. I have one contracted outreach worker who is going to people's bedsides in a shelter, going to their tiny homes, going to shelter-in-place hotels, meets with them at their bedside, but they're assigned to each building. So we might have 10 outreach workers if we have 10 rent-ups going up simultaneously. This one person you described, who's going to be the outreach worker, is going to be a U.S. Vets employee, is that correct? And is the idea that he or she will get to know all 60 of the veterans who are spread out all over the county and will form a relationship, help them fill out paperwork, greet them at the door. Can you tell us more about the details of how this works?
Yes, so the outreach worker works in conjunction with the by name list. So if there's case conferencing that goes on, as you heard yesterday, that happens regularly around the veterans that are already on the by name list. So there are other organizations that are part of that case conferencing, community partners, SSVF providers, and our outreach worker will be part of that. US Vets already has outreach workers on the ground in Inglewood who take part in this. So it actually is more than one. That's one specifically for West LA for US Vets. But also VA's outreach workers are anticipated to work in conjunction with that process as well. So it's not just one person, working alone, going out, identifying people. They're working with the system. They're working with other partners in order to identify and help veterans who are not yet signed up for HUD-VASH or missing their documents, help them through the process in order to help them be more successful with accessing housing, whether that be HUD-VASH or another housing.
So I guess what I would really like to maybe, Hopper, we can request of our colleagues here that we get a written plan about all these details, which are so critical to the functioning of permanent supportive housing.
outreach, what's the caseload, what's their skill level, what's their training level, what training do they have before they start their first day of work, how many people are going to be on site as MSWs, as LCSWs, who's doing the work, what's the relationship between property management support services, who has access to medical records, who doesn't, how is HIPAA being provided, all these very basic functions of how you do PSH, to me, is behind the curtain. And that makes me really uncomfortable. So I would love to see the written plan with timeline that we as a board can take a look at, provide advice and support, so we can, help you to get this done, provide resources if we have it available, and also hold you accountable to do this so that we can house these 60 senior veterans quickly and with respect.
Absolutely, and there is a supportive services plan for each of the buildings within Building 207. So, yeah, I hear you on this. Tenant selection, but part of the tenant selection plan is the supportive services that you're referencing.
So let me just ask a follow-on question to that, John. Is there a benchmark set of requirements that you intend to use to write the contract? Or will we develop the requirements as we develop the solicitation?
So the benchmarks in the contract are based on national standards. So HUD-VASH has developed a national template, if you will, for these kinds of contracts, and our contract mirrors that national template. Part of what we need to develop, and you've heard some of the tenant selection piece, is we're making the referrals, and we need to make those referrals based on what makes sense for our population. So we don't want it just be high acuity that would turn the building into a place that no one would want to live. We need to mix different populations in these buildings, some high acuity, some less acuity, to ensure that first that the building is safe, stable, a good place to live, but also that we serve the needs of our veteran community. So that's part of what we're developing now, and of course we'll be working with our partners. We're providing services well.
Sean?
Sure. So, thank you. When do we expect that solicitation to be out? I mean, if we're 2 months away.
The solicitation should be out shortly. I'm not going to give you a date. Our goal is certainly to have the thing awarded before the buildings are open. And there may be an opportunity for whoever selected that we're getting close to a selection. When we're getting close to selection, there's some opportunities for those contract vendor to start recruiting staff without actually hiring them, but they can start recruiting staff in anticipation of the selection. So it can go faster that way. So even though we might have only 30 days ahead of the building opening, the recruitment process has already started.
But 30 days ahead of the building opening is very soon, right?
It's very tight, no question. That's why we need to do informal things, like making sure that if we have a strong candidate, that they're aware that they're finalists, and they should start the recruitment process ahead of the formal selection.
Thank you. I think that Dr. Bamberger has voiced a lot of really important questions. I know, for me, I just can't wrap my mind around the fact that we've known this is coming for a long time. Like we don't have a lineup or a list that shows us who's going to be moving in there now, and that we're not doing all of these things like setting up case management, case conferencing, and all that right now well ahead of it, so that there's a smooth process.
I do expect it will be smooth. So we are planning to have referrals in November. So there'll be referrals well ahead of the building opening. So I don't think in terms of referrals we're behind. We just want to make sure there are a couple of things that we don't have answers to yet. Eventually we'll have to proceed regardless. One of the things is, can we get waivers on this AMI piece where we have service-connected veterans with high disability? We don't want to leave out of this. We'll take whatever steps we have to take eventually, though. We're obviously calendar is inexorable, and we're going to have to be able to state what our tenant selection plan is very soon. So our plan is to have that available in November and start referrals in November.
Okay. And is there a communications plan for the,
Oh, yes, there'll be a communication plan with that. There will not be surprises. This is going to be transparent.
that is wonderful to hear. I think probably what we're seeing here, what many of us are concerned about is that this is, I know that in other times I've had an opportunity to work with the federal government on efforts to help vulnerable folks. 2 months is like tomorrow, right? So I think that's why we're all a little bit nervous, but I'm really glad to hear that you do have a plan, that there is a communications plan in place, because
It's not in place. There's a plan to have the plan. Whatever. But I'm telling you, I'm giving you my commitment that's going to happen.
wonderful thing.
And it'll happen.
Would it be possible for the, I know we won't have another big meeting like this before this comes out. Is it possible for the board by email to get kind of regular updates on this?
And we could always set up, I'm sure a Zoom, well, I don't know what the legality is, but, I'm happy to provide updates.
Wonderful, thank you.
Just wanted to add too that we're already working with CERS and GLA as well on communications. So we're jointly talking about how to best get the information out. And then also, Tyler, could you speak more to TSA in terms of how communication usually works when buildings come online? Because I know your team also has expertise working directly with the communications as well.
I don't know much to add to what Tess said, other than the TSA team, the USS team, the GLA team, CERS team, and also collaborating on every single week basis right now, developing all these different plans that are going to roll this out effectively. So we all share the same area to making it happen expeditiously as we possibly can. Obviously, want to go right, so we can't do it.
Mr. Montgomery.
One of our key themes from yesterday, as we listened to a variety of different reports, was the evolving nature of what's transpiring. A lot of good things are evolving. Keith is working on a coordinated entry system specifically targeted to veterans. John is working on a number of initiatives that will facilitate. We've heard about a couple of them this morning. So I just don't want the burden of the system, which isn't working. Actually, it's not working for the housing authorities. It's not working for provider agencies who are already out there in the field. I don't want that burden to fall on these folks, because they're at the bottom of a system that's kind of broken right now. I think the promise to you is there's a lot of work being done to fix that system. And I think in the commitment that John has made, in the continuing work that Keith is doing, that the system is going to get better and provide an opportunity for you all to be on track. And I think the fact that you're partnered with one of the outstanding providers of services for veterans in the entire country, I think that's an important ingredient. Someone who has a lot of experience in moving people into housing, knowing how to support them in the housing, knowing how to provide the appropriate case management resources, and certainly what we heard this morning in terms of the fusing of two different sets of case management. All of that bodes well, and I think it's all part of that theme of evolution that we were talking about yesterday. So even though I'm not particularly a Darwinian, I'm not fanciful about Darwinianism, I think this particular evolution is going to work well for the lives of homeless veterans. So you're not burdened by the system that's failed. We're going to try to make that system responsive to what you need and to the other provider agencies. Thank you.
I would just respond that we're part of those conversations with the VA team, and there's a constant feedback loop, as I mentioned, on an almost weekly, if not more often basis, to give feedback from the front lines in terms of what is needed. And there's all kinds of things that are happening with Dr. Harris, Mr. Kuhn over here, and their teams to make sure that we're continuing to improve the process. So there's a lot of work, and that's what we can continue to do, not just for 207, but as we move forward, is look at what lessons are learned and continue to improve and continue to adjust. So thank you.
Okay, thanks very much, Tyler and TSA team. We appreciate the work that you've done and look forward to it.
Great, thank you.
That's the housing. Next up, we have Shangri-La. Move from the ethereal to Shangri-La. Yeah, please make sure you identify yourself when you speak. Thank you.
Getting a good call.
You should definitely.
Hi, good morning, everyone. I'm Eric Crispon from Step Up, and we're partnered with Shangri-La on the buildings 205 and 208. So we're going to provide some construction updates and then talk about our services plan and these up. So I'm going to pass it over to Joe Cowan to start from Shangri-La.
Good morning, Joe Cowan, Shangri-La. I am the project manager for buildings 205 and 208. And I guess a high level of the construction that's taking place is complete rebuild of the buildings aside from the core and shell. Everything you see there is new. We'll be providing 122 units between the two buildings, primarily on levels 1 and levels 2. Is that better?
Yes.
Okay. Oh, next slide, please. So I was saying 122 units between the two buildings, primarily on levels 1 and level 2. The basement levels will be a mix of residential as well as support services and community spaces for the residents to use. The courtyard will be transformed into this a great community space for all the veterans to mix and mingle with each other. There will be a bocce ball court out there, as well as seating areas for the residents, community garden for them to gather at also. So it's really a sense of the community between those two buildings, and actually, I guess, all three buildings when it's all complete, including 209. Right now, we are tracking a January completion, January 2023. You might see on the slide a December completion. It was just, and I apologize for the discrepancy, but we were waiting on some lead time directives from one of our subcontractors in regards to the materials. But, you know, I think at a high level that explains what we're doing to these buildings and, you know, what you'll be receiving when we're complete. So, let Ari, go ahead.
Hi, my name is Ari Major. I'm with Friendship for Affordable Housing. We are partners with Shangri-La and with Step Up team. I've been involved since 3 years ago when putting together the financing for the development of projects 205 and 208. You can go to the next slide, please. This slide tells you a little bit about the Shangri-La and Step Up teams. It's a comprehensive team. It's a full service similar to what you've seen in other projects, from early to pre-development, putting together the financing, putting together the lease packages, putting together everything that needs to get done, leading to construction, through construction, and then lease up as well. Next slide, please. In the same form, the team that we have here, and obviously there's many other members, these are the representatives that are here today. All of these functions that you see on the screen are part of what we do as a team. Obviously, certain parts of the team take the lead on construction, certain parts take the lead on support services, the Step Up, which you'll hear about soon. Next slide, please. This is a little bit of a visual of what Joe was telling you about. It is the two projects at the end of the North Campus, Building 205, Building 208, which will be hopefully ready very soon. I think you probably all are familiar with the type of projects they are, the construction that went into it. Maybe some of you have visited it as well. So these buildings are what we've been working on the last little more than 2 years. And this just gives you a little that for me to do?
No, that's a earthquake exercise, so everybody can drop cover and hit the floor if you want, or we can continue. So it's the Great Earthquake Shakeout, Great California Shakeout for earthquake preparedness. So it's organization wide. Hit respond and close, won't come back. The bottom. Know that you're supposed to hit the ground before the shake makes you hit the ground, right? Respond and close.
Okay, so again, these are the visuals, you can see on the bottom picture on the bottom, right side that you're looking at. That's the 3-building campus of building 205 closer to me, building 208 behind it, and then building 209, which is also already functioning. You can just see a glimpse of it. So those 3 properties will serve as like a mini campus almost. They'll have some shared area in the courtyard and services that are, of course, we have services dedicated to each building, but there'll be some economies of scale and sharing of amenities and services, parking in front and in back. We can answer any specific questions about the construction, but I don't think that's the focus of this. These are just a glimpse of what you're going to see. The units are very nice. We're very proud of the housing that will be provided very shortly with these buildings. Let's go to the next slide, please. As Joe mentioned, we had an estimated completion date of December 22. Right now, we're dealing with a procurement issue of supplies and materials that are delayed further than we thought. So it may stretch into January, as Joe mentioned, but we're pushing as hard as we can to finish by December 2022. And let's go to the next one. I'm going to turn it over to Step Up. We have 3 representatives from Step Up here today. I'm sure you're all familiar with who Step Up is, and I'll turn it over to them.
Yeah, hi, this is Aaron Criswell again from Step Up. So I'm going to talk a little bit about the lease-up process. If we could go back to the previous slide. And the services. We will accept referrals, and basically everything that Tess said was so well said, and many things will align for our projects because they're very similar. But we're working with the VA on the biweekly SERS meeting. We're working with LASA all to prepare the lists and get these names, in advance. So we'll get these referrals so that we can start processing them ahead of time. We've requested and received positive feedback from the VA that we can get a 2-for-1. We want to mirror as much as possible what we did with building 209. So we leased that building up in June of 2017. And we had staff and boots on the ground working with that list of veterans prior to the opening date. And we did have a 2-for-1 list. So we had about 110 names on a list for 54 units. And we were very successful. We leased that property up in 2 days. So it won't be the same abbreviated schedule like that for 205 and 208 because we're adding tax credit paperwork and some additional efforts that will be required. But we are very confident if we get that 2-for-1 by name list in advance, we can do a lot of pre-processing and getting the folks ready. So we're working very closely with the VA, and we appreciate John Kuhn's commitment to try to help us accomplish that. So I think this was mentioned in a previous slide, but Step Up is the property management company as well as the service provider, and we're really modeling this based on our 209 and our community-based, project-based batch buildings. So we currently have Step Up on Western in operation, and we have 2 additional motel conversions that are going to be coming online in the next 3 or 4 months. So we're gonna model that across the board where we see it as the most effective strategy, where Step Up is the service provider and the property management company. It really allows us to work very closely together on lease up, but also on housing retention and the ongoing services. So we will be processing those names. We'll have a concurrent process with the HACLA application. So the HUD-VASH team will work with the veteran referrals on that application while we're also working on the housing application and tax credit paperwork. HACLA says it typically takes about 30 days. We've seen them to process and approve an individual. We've seen them work faster. We've seen it take longer. So we're hoping it's 30 or less to, to keep that momentum going forward. So once we get the TCO and CO for the properties, we will ask HACLA to come in and do the housing quality standard inspections so that we can get all those units pre-approved, which is sometimes a time killer as far as the move-in process. And then once we're ready and once we assign a move-in date and we do the lease signing with that individual veteran, they will move in and take possession of their unit. These units are turnkey. We'll work to get the welcome home kits. All the units are fully furnished. So we want to design a building and units that are walk-in ready. If the veteran has nothing but the shirt on their back, they will have everything they need, at least for the initial period of occupancy, so we can help them transition to that housing state. Next slide, please.
What's the TCO/CO?
Oh, certificate of occupancy, sorry. Temporary certificate of occupancy, or hopefully just the certificate of occupancy. So we can't move anyone in. So a little bit about Step Up as a service provider. We've been around for 35 years. We have close to 400 employees, and we've been doing permanent supportive housing since 1994. So we have a lot of history in it, and we have been a mental health service provider for 35 years, but a PSH provider since 94. So we're really building on this, and we saw the need really going back to the early 2000s to develop more permanent supportive housing. So we became co-developers, really tried to develop and push more housing out to the folks that were there to serve. So we have hundreds of veteran HUD-VASH units, but we also serve homeless and chronically homeless individuals as well throughout our portfolio. And we currently operate at a housing retention in the first 12 months of 97%. We attribute that high level of retention to the high fidelity that we have toward the housing first and harm reduction models of both service delivery and property management, and the close coordination between those two entities. I think there were questions earlier about the inherent tension between property management services. We absolutely recognize that as we come in to work on those coordinated approaches. But when it's all under one roof, we have so much more flexibility in how we approach on a case-by-case basis, working with an individual who's struggling to stay in housing. We're able to employ innovative ideas and approaches and work very closely together to find a path to success. And of course, eviction for loss of housing is always an absolute last resort. Next slide, please. So everyone moving in will have a HUD-VASH case manager. We anticipate that this will follow the same models as our other projects, where Step Up will be that HUD-VASH contracted agency. So I think that some of these specs were mentioned before, but it's a 1:25 ratio. This team will start out doing outreach to engage the applicants and then help them through the move-in process. So it is very critical. I heard the timing was discussed earlier. The sooner we know the contracting is in place, the better outcomes we will have as far as moving folks in and getting them engaged with services. So services are on site Monday through Friday, but on call and after hours. But we always have a resident manager who lives in all of our projects who will be there 24/7. It's available for emergencies and to help coordinate any situations. And because we're one large team, we consider that property management staff as part of the same team of services. But there are issues with confidentiality in certain areas where they don't overlap, but so much of what the work that we do can and should overlap. And that's why we think we're very successful doing that. Everyone will have an individualized service plan. Our target is to help people not only just keep their housing, but move forward in whatever goals they have in their life. So that plan needs to encompass all of what they're trying to accomplish. And of course, we make sure all of the benefits that for which that individual qualifies are there, available to them, and we support them in keeping those facilities. Next slide, please. So how do we work closely together? You know, we meet, especially when a building first opens, we meet weekly or more frequently between property management staff and services staff to review situations, look at difficult behaviors that might be occurring. Anything that could potentially cause loss of housing is something we hold as a high priority. We want to talk about that. We want to strategize around that. We include the veteran in these strategizing sessions. We want to help people improve, and generally that's what's needed in order to retain your housing. So also on site, we're providing life skills services. These are basic activities of daily living, helping people learn how to transition from living on the streets to living in permanent housing. And that capacity stays with them as long as they're a tenant of the building. We're continuing to help people improve in all the aspects that are required in order to maintain your housing. We also, have strong supports to connect people to critical appointments, like medical appointments, psychiatric appointments, anything that's critical to their care and their case plan. We can assist with transportation and other resources to make sure that they maintain that access. Next slide, please. So Step Up is a full-service mental health provider, and we have been for decades. And we bring this experience to bear into our permanent support housing projects. And whatever services are provided directly on site, our case managers link individuals to in the community, and we help them make sure that we follow them through all those to ensure they stay connected. Next slide, please. So highlight that we have a 97% housing retention rate for 12 months. Can I dismiss this? We've housed thousands of chronically homeless individuals. We've expanded our housing beyond California. We're in Florida. We just closed on a deal in Asheville, North Carolina. So we're expanding this mission because our mission is to end homelessness. Next slide, please. Thank you. Open to questions if anyone has some.
Dr. Bamberger.
Josh Bamberger for the record. Thank you again, and again, it was such a pleasure to tour these sites and see the beautiful architecture and the setup. It's going to be an incredible home for parents. A couple of other issues that are, I think it's unique to Los Angeles and this campus. If someone needs to be held on a 5150 psychiatric hold, who do you have available to you who could do that? Do you have to bring in the sheriff, the county sheriff, or can a VA staff person assist you? How, well, of course, we hope this not be necessary, but do you have a specific plan already in place?
Yes, in our mental health teams, we always have LPS designated staff who can write the hold.
How do you transport?
We usually call the police, but in this case, it's the sheriff's department is the primary resource for the campus. But the VAPD have been very helpful when we've had situations like this to help maintain safety and keep the individual safe while we're waiting for the wheels to turn to get them.
So you have to call in the sheriff from the county to come into this campus to transport somebody. Does that work?
It takes management and it takes good communication. So we've had many meetings with VAPD and there have been changes of that staffing, but we've been able to talk to them about jurisdictional issues and how best we can all work together. The VAPD has been very accommodating, even though it's not technically their jurisdiction, because it's an enhanced use lease. They will still come and assist, certainly if there's any safety issues or concerns, until the sheriff can come on site.
And I think, I'm just trying to help Joe, who here to, because this is his issue, but I think it is an issue that needs to be fleshed out a little bit easier Because clearly if someone is actively homicidal, suicidal, having multiple different agencies come in at various rates of speed, it could be a problem.
Dr. Van Berger. Oh, sorry, Dr. Brennan.
Yeah, this is Steve Braverman, thank you. So, number one, in the last year, we've implemented a VMS team, Veteran Mental Health Engagement Team. So that's police and provider. They respond to anywhere on campus, also with the clinician off campus. We have joint jurisdiction between VHB and the Sheriff's Department for issues that occur on campus. Calling 911 is the usual venue to make things happen, and we coordinate those responses. The LA County Fire Department is the ambulance response. So we have processes in place for response and the ability to assist. We haven't identified, to my knowledge, any situations where we've had a negative outcome due to a delay, but we'll continue to monitor that.
And before we take another question, I wanted to take a moment to introduce our CEO, Todd Lipka. He had a few comments that he'd like to make.
Thank you, Todd Lipka, CEO for Step Up. And I just wanted to punctuate the discussion earlier and to say, Mr. Kuhn, I am greatly relieved to hear your announcement earlier, because once we were awarded these projects over 4 years ago, we've been trying to get clarification on the contracting for services. And your pronouncement was the first clear message in those 4 years of the VA stance. And I do appreciate the systemic issues that we're talking about and the mobilization of resources to create greater efficiencies in the process. As Aaron mentioned, we were the blazing pioneers on the campus for permanent supportive housing with Building 209 in 2017. And we leased that project up in 2 days in coordination with the VA for the referral list. And as Aaron mentioned, we had twice the number of referrals per units, because that's partly what it will take. From our perspective, we need to back up the system to start 5 to 6 months before a project will be open, because in the contracting for services, we need to go out and recruit, which, as you know, these days is very, very challenging. And then once we hire the staff, they also need to get verified by and approved by the VA to provide services to veterans, which could take a month or 2 months. So we're thinking 4 months ahead of time to have these staff on the ground actually going out to engage people. From our perspective, and we've been doing this now since 1994, leasing up permanent supportive housing projects, veteran and non-veteran projects. You really want to be engaging those staff. To Mr. Bamberger's question earlier, I don't think they should be outreach staff. They should be the case managers that are going to be on site, because you want to have continuity of service so that the staff who are engaging individuals out on the street or at the VA, assisting with the paperwork and all the logistical, are also the same staff that are going to be working with these individuals in the housing itself. So from a perspective of thinking efficiencies and really getting veterans housed as soon as possible, you're really talking about a 6 or 7 month period prior to opening up these units to have staff to start the process, to recruit, to hire, to get approved, and to send them out on the street a couple months before the building opens, so that ideally we can come closer to replicating Building 209, maybe not in 2 days, because the tax credit project is much more complicated on the paperwork side, but we should be waiting months to fill these buildings. And as the developer, this team is not only doing these projects, we're also doing 3 motels. We opened Step Up on Western, 35 units, about 6 months ago. It's still not fully leased up. And we have 2 new motels.
Over a year ago.
Over a year ago, I'm sorry, not 6 months ago. And then we have 2 additional projects that are motel conversions exclusively for homeless veterans, totaling about 170 units that will be opening up in the first quarter. And that is a really big concern. So we may be behind the 8 ball in mobilizing new resources now, which we greatly appreciate and applaud. we also have projects coming in the future that we can think about backing up that timeline and doing it as soon as possible. And we're committed to working with the VA to do everything to make that happen so that we can house veterans as immediately as possible once we have the C of O and veterans can move in. There's no reason these buildings can't be fully occupied within a few weeks if we're very thoughtful and prepared in our preparation work and working together in a collaborative way.
Mr. McDonald?
Again, thank you for the presentation. Just had a couple of questions. You anticipate these two buildings to be ready for tenancies in January, is that right?
Yes, that's correct.
So then that would be added to the presentation we heard before you in terms of, again, occupancy oriented toward January. And your CEO just mentioned that you've got, what, 2 motels with capacity of over 100 and something, also up and ready to go in January. So what level of confidence do you have that you will have sufficient referrals, especially given your desire for a 2-for-1? What level of confidence do you have that you will have that ready to go, those choices ready to go so that you can occupy these buildings in a reasonable time after they are ready for opening in January? What percentage would you assign to that?
Percentage of confidence?
Percentage of confidence that you will have tenants in the units created in 205 and 208, say by the end of January?
I think those are 2 separate conversations, because what we've seen is there does seem to be a lot more interest in veterans living on campus. And so our experience with 209 was very smooth and we had no shortage of referrals. We're hoping we'll see the same outcome. And my confidence level for that would be 50% right now, but I'm very optimistic by the things that we've heard from VA and the processes that we're talking through. So I want to see that number will go up. I hope we have another meeting tomorrow. I hope we continue to get some good news, and some good strategies in place.
We're actually, well, we're actually going to be meeting right after this, but we fully, John Kuhn, acting deputy medical center director. It's a mouthful. We actually hope that once we fill these buildings, which we will do on campus, it'll have a domino effect, and people who are waiting and turning down options like Western will now consider Western and other options because their first choice is filled. So there is significant demand for these buildings on campus, and I think once we fill those, there will be a domino effect. We'll chat more about that.
And Philip, the other component are the motel conversions in the community. As Todd mentioned, Step Up on Western opened in July of last year, and 32 units, and we are still at about 60% occupied. We've just had a paucity of referrals, and so that's been the delay and the difference between a project like Building 209 and Western. So my confidence on West 3rd and Broadway, adding an additional 170 units, is a little bit low right now. But I'm hearing very positive things, and we will partner at the highest levels with the VA to fill these units. We just want veterans off the street in these projects.
One of the things we heard yesterday was actually a protracted conversation about people not wanting to live in units and that they choose not to live in a unit. So I'm wondering, in your experience in the 209 process, in filling 209, which has how many units?
54.
And you had double the referrals. What percentage of those folk who came said, we don't want to live here, we prefer to live somewhere else?
Actually, a very small percentage, because that was an active fluid list. We were working very closely with Intake Center at the VA, our HUD-VASH staff. And so we were working with individuals well in advance. So if somebody did start to express a lack of interest, which very few people did. That was a very small percentage. We had a lot of interest in people getting onto the campus.
In your,
So for their social workers.
in your other developments for homeless people, how is that factored in? The people, homeless people come and say, we don't want to live here.
So for example, Step Up is both a tenant-based HUD-VAC contractor as well as the project-based contractor. And we receive tranches of referrals every time we hire a new HUD-VAC tenant-based social worker. They outreach to those individuals and start the process of enrollment. All of referrals we receive for tenant-based, we talk about our project-based openings. We advertise it, we take them there. And the staff report to me that about 20% of the number of referrals we get are even interested in Step Up on Western or one of those outside community projects. So it's a small threshold.
So 1 in 5 is interested, or 4 in 5 are interested?
One in
1 in 5 are interested in living in Western. So 4 out of 5 reject Western. And have you thought more about, because part of our discussion yesterday was, how can we induce people to live? And I appreciate what John was saying about filling the project-based units on the campus, which seem to be more attractive. What inducements have you created to overcome that 80% desire not to live in your project?
Well, we really focus on the relationship. These are folks that are being enrolled into our HUD-VAC program. Sometimes the answer might be no, but if we continue to build trust and relationship, we might be able to convert that to a yes. But it's veterans have choices, and we love and value that. And a tenant-based voucher gives you a lot of opportunities to look and maybe find something in an area that you prefer. So we understand that, and we also understand that there are many HUD-VAC project-based vacancies throughout the county, and that's also a good function of choice, but a difficult issue to fill out. But we're getting, between all of our efforts, we do our own outreach and refer into our program. We get referrals from other HUD-VAC contracting agencies, and of course we get referrals from the VA.
In your experience in Building 209, was that a more attractive place to live for veterans than other locations that you had? Is that your sense?
We didn't have other locations at that time, but it was more attractive, particularly because we target 55 and older. So there was more of an interest to be closer to the hospital. And also, these are very nice units. They look good. They're probably a little larger than an Intel conversion unit.
Right. So what John is saying, there's some credibility in that once the units are filled here on the campus, which may be the more attractive units, that people will realize, oh, they can't get those, and they could potentially go to other ones. Does that resonate with you?
Well, it's not been our experience so far, because we have openings at 209 as well. People tend to prefer the campus right now.
Right.
And if the campus isn't available, they have tended, at least in our referrals, to prefer the tenant-based voucher and just look on their own.
You have openings in 209. Are you getting the referrals to fill those openings?
Yes.
You are. So that's not fine. I just have 1 or 2 other very brief questions, Carol. In this document, you indicate that you provide services Monday to Friday, 8 to 5. And I know it says on call, but one of the criticisms we've heard in many, many places is the VA only provides services 8 to 5, that the private sector, the outsourced, has a much broader sense of case management services. So I don't get why you have 8 to 5.
Well, those are the typical hours of service delivery. We have in the past staggered schedules. We've looked at options. We once met with the chief of police in Hollywood around one of our projects, and they said, well, why don't you have social workers working throughout the night? There are issues that happen at night. And our response to that is, that's not a social work issue. Those are challenges, those are concerns, but we have other staffing such as security and property management who can thread the needle and make sure that if there is an emergency or a mental health crisis, there's access provided to the.
So there are no general case management issues on Saturday and Sunday during normal hours, 8 to 5, let's say?
There can be issues, but we plan for those. You know, we build and stabilize the community. And really, it's about a 6 to 12 month process for folks to start to stabilize and build that community. And that's what we work towards. So if we see that there's a need that's not being addressed, we adjust schedules based on that need.
So my final is more of a comment than a question. I heard from Shangri-La that there are procurement issues. So January, you're not quite sure if it's January. I just reflect on that. There are multiple projects going on in this campus right now. There are many projects going on. And what I note in those projects is there's not any delay. I know that's much to the credit of Dr. Braverman and Alan Trin for having done such a remarkable job of organizing the resources necessary to complete projects. And if alternative A doesn't work, there's an immediate alternative B that goes into place. My understanding is of all the projects, not one of them has been delayed in any way.
Our kitchen, for example. Our kitchen's delayed, so for the large building construction projects, there are delays that are ongoing on all of them. So for infrastructure, not so much, but for, the building ones, we're seeing delays in other places too. It's not just these guys, and I wouldn't consider it a failure.
As Alan said earlier, Plan A, Plan B, keep things moving forward. So, right, so knowing that there are issues that need to be resolved in terms of the availability of things and procuring them, I think there is a good lesson, there's a good model here that maybe some tutorial could be done in terms of ensuring that there aren't the kinds of delays that we constantly hear in terms of procurement. Thank you for your patience, Mr. Chairman.
Record reflects that. I've got no issues, all of it's no question. Okay, so the order is going to be perfect. Dr. Bamberg.
Jim Gurley, for the record. How are you dividing up the referrals between 3 buildings that are coming online about the same time between the different buildings?
This is Aaron again from Step Up. Well, that'll be in partnership with the VA, and of course, it'll be Veteran Choice as well. So it's an unusual opportunity to be able to give multiple choices to someone who's seeking housing. So that'll be our first priority. And then if there's no preference, we'll offer all the units in tour.
Okay, so everybody's going to see the whole list and all 3 teams. All the veterans will be on everybody's list.
Actually, I don't think that level of the process has been totally worked out, or I'm not familiar with it yet. So I think we're still working out those details.
My other question, is this a 4% tax credit deal or?
Yes.
Yeah,
this is our, yes.
Have you locked in your rate on your permanent loan yet?
Yes. We, so 2 parts. We do have a permanent loan with a fixed rate, thankfully.
Yes.
We are struggling though because our construction loan is a floating rate loan. So the longer it takes to complete and the longer it takes to lease up and then convert to our permanent loan, we are, dealing with that issue right now, work with some interest that's well above anyone's budget, including the lender's conservative budget. So we're working through those things. We're going back for different sources to fix that problem. But luckily for the long term, we do have a fixed rate.
You're going to be able to handle the difference in the short term financially.
Yeah, frankly, going back to TCAC, TCAC created a program for supplemental bonds, which triggers additional credits. So we have a plan to fill that gap. And for better or for worse, it's on us as developers. We are the guarantors, the tax credit partners. We're the guarantors on the conversion to permanent loan. So unfortunately, it's our problem and we're dealing with it.
Thank you. Mr. Alman.
Anthony Allman for the record. In reading one of the slides, I noticed that there's HACLA listed as the housing authority. So building 209, the vouchers came from HACLA, and the same is true for 205 and 208, correct?
Yes.
Is HACLA awarding all your project-based vouchers?
Yes.
But I don't think that's the same for the other developers on the campus, right? I believe the principal developer and 4 companies for MacArthur Field, those vouchers are coming from the county, correct? That's correct. So the reason why I bring it up is just in comparing apples and apples, apples and oranges, when we're doing this discussion of the lease-up process, I don't know the answer, but how is that going to create maybe a different process because you're dealing with 2 different housing authorities? I think Step Up and Shangri-La might be in the unique position that all of your vouchers are with the city of Los Angeles, but moving forward, the rest of the campus will be with the county of Los Angeles. So I'd maybe hear from VA how the process differs, if at all. I don't know.
John Kuhn, Acting Deputy Director, Medical Center. Honestly, I don't think it matters which PHA is issuing the voucher. That should be immaterial, though.
Just knowing the differences in culture between government organizations, I wouldn't be so sure. I'm concerned, and on the services end, I probably know the least on this board. So I just wanted to throw it out there. I think it's something for all of us to consider. I don't know, Dr. Bamberger in San Francisco, I think you just have one housing authority.
Not my area of expertise.
Yeah.
Okay, so John Bamberger for the record. So first of all, I just want to acknowledge the elephant in the room. You've got a hard job ahead of you, right? The VA has not been supporting you adequately to get the things done you want to get done. But I feel very confident with Chief of Staff here, John Kuhn. I'm very hopeful that the challenges that you have faced are going to be relieved, and that hopefully you will get the sole source contract. I don't know. Maybe that'll happen, maybe it won't. You'll be able to fly, and veterans will have a wonderful place to live. Our job, I think, is to make sure that whatever these barriers are as limited as possible, and continue to give us feedback so that we can support you in doing the wonderful work that you have done for many years, and I'm sure will be doing for many years in the future. Some of the things I'd just like to highlight, overdose prevention. One of every 4 people who die from an opiate overdose do so within 2 weeks of entering program or housing. So making sure that you have naloxone or Narcan available, and that your staff is adequately been trained to be able to administer that for people from the jump, that you have literally naloxone taped to the walls of every building, and all the people who come in know how to use it, and that you're not restricted based on your union issues or your hiring issues, that your staff are able to administer it freely. That's a question. Are you able to do that? Do you do that?
We'll have to review that. There are different governing bodies at different locations in different states, but we will look more thoroughly into that. I'll have to get back to you.
Please
Josh,
do.
Can I just really quick, because I'm gonna have to step out, just first and foremost, yes, we have a lot of work to do, but I would be absolutely remiss if I didn't say how proud I am of where we are today and the amazing work that we've got to be at this point. Yep, it's important. I'm excited to have John on board. I'm excited for the energy that he is bringing. I am confident that we are going to be able to overcome all of these hurdles. We need to know what they are so that we can work together in order to do that. But, I've only been here about 19 months, but to see where we were and where we are is just amazing. And so I thank you. We will work hard to try to get veterans in all vacancies. It is so important. We understand that. We do not want to see any veterans who are not housed. That is our ultimate goal, and to partner and do everything we can to get those filled to the best of our capacity. We do have Veterans Choice, so we'll do everything we can with that. But I do think John has some wonderful ideas that he's working together with his team in order to move forward. And so we will support. I have to go do a national homeless meeting, so I apologize. I'm going to step out, but I just wanted to say a couple of words before, in case I didn't get to see you guys. Thank you for all that you are doing. I really appreciate it. Wonderful to see you, and thank you. Sorry to interrupt.
Thank you, Chief.
No, I mean, there's no more important words than coming from you. I mean, I think that's exactly what we are hoping to hear, and it seems like progress is gonna happen. So just worried about overdose, put that out there, and then your 2-to-1 thing is also really important, because if you have double the number of people in units, half the people are not gonna be housed in that building, so where are they going to be housed? So that's a critical piece of working together with the VA and make sure that if somebody doesn't get to move into a unit that they have been filling out paperwork to do, that they can have another place to live. So you have to work with your, your other buildings that are vacant, or the other scattered sites, so that everybody who goes through the process knows that they will be housed once they go through that process. The only things I would say, again, just really looking forward to the next steps.
Okay, I think that's it. Thanks very much, gentlemen. We appreciate it.
Thank you.
We're going to, actually, first, let me offer you the mic. Any comments for this board today, or perhaps sharing anything in your tour?
Good morning, everyone. Thanks for the presentation. It's good to see you all as well. Been looking forward to January and the celebration. We got a chance, the chief and I, before she stepped out, of course, for the national homeless call that we have every other week, to walk around the CTRS facilities and speak to veterans and learn more from the social workers and from Deborah's team and the amazing work that's being done on the ground. And from where we were 18 months ago to where things are now, at least in the lowest barrier to entry, housing solution that's been constructed, I think it's phenomenal. I mean, emotionally resonant, and I think that's really great feedback that we're going to take back to us, back to Secretary McDonough and the team back in DC. But we're here to support everything moving forward, and we're excited for him to be back out here when we open these next few buildings. So thank y'all so much for taking us around this morning, and I think we're looking forward to more progress as we move on. Thanks.
Thank you very much. Let's take a 7-minute break while we tee up the folks in Washington for the WebEx visitation. Again, to the folks from Shangri-La and CSA, thanks so much for your visitation.
Mr. Sims, are you on, sir?
Yes, sir.
Very well. Mr. Sims, if you're here, we're going to take about a 7-minute break, and then we'll queue you up, your chart, and we'll listen from this.
That sounds great. I'll be ready.
You ready?
The permanent?
I like it.
Appreciate you holding this here. Always tricky. So you got the authority. You have the authority to do this. That needs to come from that one.
So there.
That would be the biggest.
Like real about you. She's a bully, that's why that happened. Oh, the 20 feet, yeah. There's. Email them to my document. Those two ways, the first one center.
Oh, no, I totally. I'd like to be sure. It's not clear. Yeah.
We're gonna figure out.
This is, she's gonna show you how it is. Let's see no more pop up.
Right, that's closing. Right, minimally voting. I mean, it's not building, so, I mean, it's not, right now you can't go in about it. You're talking.
Right, we'll do that.
Even if people. I was here last meeting.
I love. Work together. I think they'll keep taking everything. Thank you. We should wait everything. Yeah, but. I know, interact with what I know. There is. Just think of it higher. Thank you. There you go. Yeah, just.
Thank you.
Fun. Exciting. You all have here. Yes. Very annoyed right now. State Department here. I just I had quite the day.
Yes, sir. Please take your seats, everyone. Okay, thanks, everybody. On the line now, from Washington, we have OAEM, and I think Mr. Brett Sims is on. Brett, are you there?
I am here.
Great, welcome. The floor is yours.
Okay. Good morning, everyone. I'm going to step through a few slides here talking about the MacArthur Field Phase 1 Enhanced Use Lease. This is being numbered Building 401A, and it is A because we will have a second phase of development on MacArthur Field later on. Focus today is just the first phase of development, which is the A. So if you want to go to the next slide, please. So talk a little bit about what the MacArthur Field development is. This is an enhanced use lease that we intend to enter into, which is the reason I'm briefing it and not the developer, but we have selected the developer, and that is MacArthur ALP, which is essentially affordable housing and core companies that have formed that limited partnership to do the development on MacArthur Field. It's about 3 acres of land that we intend to put under the enhanced use lease. This will be new construction, unlike buildings 205, 7, 8, and 9 that were all retrofits. This will be a new construction project. Total of 75 units of housing will be built, 74 of which will be for housing, and then 1 manager unit similar to the other projects. There will be supportive services provided, as with the other projects. In this case, CORE has selected New Directions for veterans as the supportive service provider for 401A. As far as the financing side, the HUD-VASH vouchers, there are 74 HUD-VASH vouchers that have been secured. To the question before, these are through the county. So these are county-provided project-based vouchers, but those have been secured, and that'll be the operational financing that they leverage for 401. Okay, you want to go to the next slide real quick? So in terms of timing on this one, we're nearing completion on execution of the enhanced use lease. The notice of intent, the document that we have to send to Congress, was submitted on October 12th, so a little more than a week ago. That starts the 45-day notification period that we're required to wait for Congress. So that is the clock that we're working against. During that time, we will also be seeking OMB review and approval of the enhanced use lease. Once those two exercises are complete, VA is free to execute that lease. We intend to do that in the November timeframe. What is driving that is essentially the financial closing. The financial closing for this project is slated for December of 2022, and it actually has to occur by that point. The financing that was secured by CORE has an expiration date in the middle of December, so we've got to be able to not only sign the EUL, but give them time to complete their financial closing in December before that funding expires. As soon as the financial closing occurs, they intend to start the construction, and construction kickoff will also be in December of 2022. As this is new construction, the construction timeline is a little bit shorter than what we have had on some of the other projects. We're looking at just shy or roughly about 18 months of construction, with completion in June of 2024. And that would be followed by the lease up in July of 2024. Obviously, we've talked about this. There are certain factors that we're building into this in terms of contingencies, but the supply chain issues at this point obviously aren't an issue because we haven't started the construction process, but that is something that we will continue to monitor to see if there are any issues related to that that would affect schedule so that we can bring those back to everyone. So that is it in a nutshell. Very quick update on MacArthur, getting close to executing the EUL for them to start the work on building the new building. At this point, I don't believe I've got any more slides, but I am happy to take any questions and answer anything that you all may have.
How about Brett telling us a little bit more about Core MacArthur?
Sorry, General Hopper, could you repeat that question? Could I tell you a little bit more? And I missed the last part.
Yes, a little bit more about MacArthur.
Okay, so Core is a company that actually participated in some of the work on the initial draft master plan. But Core is also a company that we have done other enhanced use leases at other VA sites. They have some in California already that we have worked with them on down off of our Palo Alto campus. So they're a company that is familiar with working with VA. They do not have any work at the West LA campus at this point, but they have done enhanced use leases. They have done supportive housing. They are familiar with the financing process, both for the construction financing as well as the HUD-VASH process. They were able to get the project-based vouchers pretty quickly and easily. So we're comfortable working with them. We have done that in the past. They're also really engaged with the principal developer team. And that's something that obviously we encourage, but it's tough for us to enforce that engagement. But they have worked very closely with the PD team, both on the service front, which I know you have spent a lot of time talking about over the last couple of days, but also on the construction side, since this will be one of the first new construction projects. Tie-ins to utilities and things like that are very important. The PD team has had the lead on a lot of that work. So Core has engaged with them. That relationship has been very good. They have worked very well together. So we're very happy with that and impressed with their ability to engage quickly with the other partners that we have on campus.
Okay. Dr. Bamberger.
Hi, Dr. Bamberger, for the record. Thanks. So in selecting this team, have there been thoughts about creating a diversity of housing stock that will be able to meet the diverse needs of veterans seeking housing? That's question one. And what do you expect the price per door is going to be for this construction? And are they trying to get it down by using modular techniques at all?
Good question. So let me start on the first one, the diversity piece of it. I think the answer is absolutely yes, but not specific to this lease. And I say that because the principal developer team will have the bulk of the development in the future iterations of projects and subleases that we'll be working with them on. There certainly is an intent to have different types of target veteran population for different housing. This one in particular, as the only one at this point that we intend for CORE to be working on, only has the one of chronic homeless and at-risk homeless as their target population there. So no specialty subdivision within this one, but certainly with the PD as we look at the future development that is on the table there. The price is a good question. So I don't have the details, so I can't give you that. I could certainly bring back the exact numbers on there. I do think that this is one that, because it is new construction, was a little bit easier to price as compared to some of the work that we had to do on the other buildings and existing site conditions and working through that. It still does have to adhere to some of the requirements, for example, of historic preservation. There are requirements that they have to adhere to, but it doesn't have as much of an impact on this project. So certainly working to lower that cost wherever possible on both our side and the developer side, but I don't have a specific number for you right now, Dr. Bamberger.
Thanks. Just, you know, the range has been quite broad in new construction, from about $350,000 per unit for these 300 or 400 square foot units that are built in a modular construction and then shipped into the facility. I know the Corps is doing one of their buildings as a modular construction, but not necessarily getting the price down. I'm just wondering where, in terms of the leasing opportunities, are you putting some guardrails to try to keep those costs to something, you know, less than the $750,000, which is typical from traditional construction?
Yeah, the reality of it is that a lot of those questions get answered and asked by the financing components of it. So when they are putting that together, in order to be competitive, they've got to have a price that is reasonable and I won't say lower because there's other factors that go into it, but they've got to be very competitive on their cost per unit or they don't secure the financing. And that is something that actually CORE experienced when they applied for financing. This project has been in the pipeline for a while. They did not secure financing when they first applied for it, and part of that was the price. So they have worked already to reduce the cost per unit to put them in more competitive nature. In the funding that they did secure here, they were competing also with the two principal developer projects that you heard about just a little bit ago, 402 and 404. They were all competitive in the financing application, and all three of them were awarded in that, but they did have to do some work to bring their costs down to get in that range.
Mr. All.
Anthony Allman for the record. Maybe you touched on this, but could you explain the differences between CORE companies and Walsh Group? Is it a joint development? Are they both developers sharing the cost?
So good question. So in this case, CORE Companies is the primary, and they have partnered, I think it's on the previous slide there, but they have partnered with another company there. But in all of these, the LLC that you see, or the LP in this case, is the special purpose entity that's formed for it. But in reality, CORE is the primary on this one. Their main partner will actually be New Directions, not Walsh. Walsh was part of some of the initial work done on the draft master plan, and they could have a role in this, but they are not the lead. CORE Companies is the lead on this.
That sort of gets into the question I was asking, because it's unclear to me, or it was prior to your statement, who the service provider would be for MacArthur Field Phase 1, potentially Phase 2. So that's New Direction.
Yes, sir.
Perfect. Thank you.
Mr. Montgomery.
Philip Mangano. So just following up on Anthony Allman's question. So when the application was made for this project, New Directions was partnered with CORE and Affordable Housing CDC as the provider of services. Is that correct?
Yes, New Directions was proposed as the service provider, yes.
And there's no question that when July 2024 comes around for the lease up, that New Directions will continue to be the provider of support services for this project. Is that correct?
Anything can change, so I can't say that nothing would change between now and then, but that was their proposal. That is their current proposal for who the service provider would be. If something would change, they would have to bring that back to us and make a proposed change to the lease once it's executed.
You know, I mean, that makes sense to me that if there's a provider agency, partners with someone, they submit a joint application and you award that in fact, that provider agency would then be, unless they withdraw, that they would be providing the services. That does make sense, because if there were a change, I would imagine, and you can help me understand this, if there were a change in the provider as it moved forward, would you need to re-RFP that?
Good question. I don't believe so. And the reason being is that the lease itself is with core. The requirements underneath of that stay regardless of who the provider is. Now, there's some of those requirements that would be provided by New Directions. There's also property management requirements and operating requirements. There's a lot built into the enhanced use lease itself that are essentially the responsibility of core. Now, we also have who they are proposing to provide those services as part of the appendices to the EUL. So if they would want to change, core as the EUL lessee could bring that to us, but it would require an actual amendment to the lease to change that out. The requirements of what they're providing would not change, but we could update it. And that would be really something that the lessee, in this case, core, would have to bring to us and propose. Obviously, they'd have to have a rationale and a reason for doing it.
So it would be core who made the decision about who the new partner would be, is that correct?
Correct.
You would have to approve it, but they would make the decision.
Correct.
Great, thank you, helpful.
Any other questions? Okay, thanks very much, Brett. We appreciate the information.
Very welcome.
Okay, I hear some calls for lunchtime. Yep, for 30 minutes ahead of schedule, so I'm proud to offer you a longer lunch today. Okay, any comments before we leave? Just by way of a comment, I imposed on Jim Purley in the restaurant, in fact, to help me understand where the money goes when the construction is complete, but the unit has not been leased yet. And the rest of you may know this, but just in case you don't, they negotiate in the process a lease-up period, so that, for example, when we talked about 2 to 4 months to get people into the units, so some are going to be sitting vacant for that period of time. Nobody is, to use the phrase, losing money there because it's been budgeted for in the process. And again, while you're sitting here, go back to Anthony's question. Can anybody add any more information on whether it's the city or the county that's involved in the process as far as getting the veterans into the housing? And
Anthony Allman for the record. So after the discussion, I talked to a few of the advisory committee members, and they didn't seem to think that it would be much of an issue. Probably, or maybe because it's a project-based project versus a tenant-based.
my concern was in developing this mechanism for leasing out, making sure that we're talking to all the stakeholders. And that was my only concern. And I think most people's feedback is that's not going to be a problem.
Basically, just so you know, is this working or not? Usually operator error. So the way this works is project-based vouchers are much more valuable. And the reason is that the voucher stays with the property and it's for a specific length of time. And the minimum probably on these are 15 years. And the reason that's important is a lender will not finance tenant vouchers because there's no guarantee. And in order to get tax credits, in order to get the permanent loan, you need to get a letter from a housing authority, the city or the county, guaranteeing those vouchers for 15 years. And it just as an aside, one of the issues that a developer will have if they use tax credits, with John's on here, you talked about that yesterday. A building on downtown is 80% occupied. The developer has to guarantee 95% occupancy for the tax credits, personally guarantee it. And the tax credits may be 150,000 units, so that if they're 10 units short, the tax credit, the investor has to write a check for $1.5 million. Plus, he's not going to be able to get a permanent loan until he's 95% occupied. So sitting there at 80% occupied means that the lender's not going to finance a permanent loan. They may walk away. The temporary loan may get called, and the developer could basically lose everything. So I think what has been happening, and it's a mistake that would be easy to make, was that the developer getting tax credits really believes, hey, these veterans really need housing. They're going to live in B or C areas, and they bet, and you maybe bet their company on that. And if they come up short, it's a huge problem. And John had it referred to that yesterday. So, and even with these, and I talked to PD also, they have locked in their permanent financing, but you guys know what's going on with interest rates. And we had a deal with very painful experience for us that we were all set with HUD to close in January, had everything we needed. The local people didn't want to do it because they already agreed to subordinate loan. They wouldn't subordinate it, and they wouldn't even tell us. And it sat there, and our rate went from 2.5% to 6%. And it cost us 25% of the permanent loan financing. And so we went from a positive to a negative position. These guys don't have that problem, but they do on the construction loan. As you know, it's a floater. And, but just so you know, these developers are taking a lot of risk. And unless they get outside help, the risk reward on the PD project, it's financially it's a loser. From a standpoint of helping the veterans, it's a home run. But these guys are taking a lot of risk. The other thing is on a project-based Section 8 tax credit deal, the upside is in the appreciation of the property due to the rents. But in a case where you have a lease, you don't get the upside because you don't own the land. So these deals financially, the team I was on, we were on one of the 3 final teams. We talked about it. We knew it was a loser, and we did it anyway. So the reason I say that is, I feel very strongly that the PD team is fabulous. If you all haven't read Steve Peck's bio and gone online and looked at his YouTube videos, I recommend it. I mean, we've got the A-team in there, and we should do whatever we can to help these guys because they're not doing it for the money. Thanks.
So I just want to fill in the previous conversation regarding the two different housing authorities. My concern, I guess, hearing the conversation this morning, how late in the game we are, we're developing this placement mechanism, you know, as we've jumped off the cliff, just to make sure that we're talking to all the relevant stakeholders. So not only the city housing authority, but the county housing authority. And it seems like from the feedback we got from Mr. Kuhn and Dr. Harris, that that's not going to be a problem. So.
Thanks, Anthony. Stephanie.
I just want to say, I think we figured out now that there's two separate issues here with the two housing authorities. One is a financing issue and one's a getting people into housing issue. And I think that's the one that Anthony's talking about. The team from Step Up spoke with a lot of confidence that HACLA is the housing authority for the two buildings that are coming online. Two, right? Two that are coming online, they are the authority for 209 already. I don't know that that's true, but I think that the concern is that there has to be some coordination amongst the principal development team, Step Up, Core, whoever all is involved in getting the applications processed ahead of time. Because what's going to happen is you're going to have people that are ready to be vouchered, and they're not going to be through the process with each housing authority. The difference in the housing authorities is they have different requirements for housing. Their vouchers are a little bit different, and it's not just as simple as tenant-based versus project-based. I know that, I wish Keith was sitting here right now, but I know that Keith is doing some of that work with Amy Perkins and, Deborah's not sitting there either. With Deborah's team also, they're having conversations on an ongoing basis with the housing authorities about getting people through the process. But I think at the crux of all of these issues is the same thing that we've been talking about for 2 days is the people. Who are they going to get through the process to get applications in and approved for housing? Nobody can move in until they've been approved by the housing authority. So I don't know what that looks like for this group. I'm very new here. But if there's an opportunity to have a further conversation to make sure that that pipeline process is happening, we want to make sure that it's happening with both housing authorities, not just one, based on the developer.
Thank you. Jim Perley.
Yeah.
Jim. I think Jim's comment, though, is going to be relevant to that, and then I can make my comment.
I don't think, my understanding with project-based vouchers we have, you don't have to go back through the housing authority for approval. The housing authority gives the vouchers to the building and not the resident. So as long as the building qualifies, then the resident goes right to the development team to lease, and that's the housing authority's out of it as long as the veteran qualifies for the housing authority's standards. And the housing authority standards are going to be a lot less stringent than the VA standards. They can be up to 60% of median income, in some cases 80%, where the VA is much more restrictive. So, and the VA is in charge of the process for selecting the residents. So basically, it looks like the VA passes a list to everybody, and they maybe fight over the same residents if they're all coming aboard at the same time. I think that's what I heard today.
HUDLA and LACDA have different application processes, though. That's the only.
Microphone.
Yeah, sorry.
A tenant-based voucher is very different than a project-based, and you're right about that. They have to go through the housing authority.
Just my God. Jim, I think we're so appreciative to you for the insights that you bring from this field. I think it's very helpful to this board, and your most recent insight about the risk that the principal developer is taking. I think too often those who aren't in development circles think it's all about the money, but in fact, it's all about the risk.
and the difficulty to accomplish the purpose that they wanted. I want to also, though, mention, it is true that developers build into their pro forma a 3 to 4 month lease up time. But if that went to 6 months, there would be money coming out of their pocket, wouldn't there?
Yes.
And that's part of the difficulty in Los Angeles, is that it's extending beyond the 3 to 4 months, which they've already built in. But it's going longer than that because they can't, from the developer's perspective, get the referrals that they need. Because they don't have those referrals, the income isn't there in the property, and they do start to hemorrhage money.
Correct.
That's why they want the referral.
Anthony Allman for the record. I think maybe one thing we can do is maybe during an IPT exchange or a subcommittee, really be absolutely certain the involvement of the housing authority, even though it's a project-based project. So I'm hearing two different things. I'm hearing the housing authority is not involved at all, and I'm hearing, yeah, they are involved to some extent. And I just think it's for our benefit just to know what the answer is. I don't know the answer, but I'm hearing a lot of certainty. And as I mentioned to Phil, you know, that's what scares me.
So just a quick response to that. I think we have developers who are involved in these efforts that have received resources from both the county and the city. So I think we could talk to them and find out directly, what's been your experience? Are there any differences? I think we don't want to reinvent the wheel on that issue. I think we want to hear directly from people who have got both and what their experience is. As long as it's similar, as long as it's apples to apples, as long as it's project-based to project-based. And I think that's what Jim is talking about. When it's project-based, hands off, it's in the hands of the developer.
I want to hear that from the housing authority.
Well, we can get that clarified at IPT. Okay, I promised lunch, and look where we are. So let's take a lunch break. Our next break is at 12:01. Is that 12:50?
Ron Baker, can you hear, sir?
12:50.
Yeah. Rob, you have to accept co-host and unmute.
Outside of some.
Hey, Rob, can you hear us?
I'm here.
Okay, great, Rob. We got you tied in.
Ask Eugene right now, or Chief.
Jim, folks, having your expertise at this table is so vital, necessary. Hey, you've been walking. Vote. Vote.
I could, but
I have a little house and
But
we're gonna keep
driving
going.
and parking and trying to walking.
Hey, Rob, is this the meeting is at 12:50?
Familiar?
You can stay online. Rob, how do you hear me?
It's beautiful. It's really preserved. It's better than, most I think Brewster is kind of like. Yeah. It's, yeah. You got there anymore?
I heard you, Eugene. We're going to take a lunch break.
Okay, that's great, Rob. Thanks a lot. You want to reapply or you want to actually stay on the list with anything else?
But I love the reality that you bring to this table because these people float on. So it's great to have you there. Are you officially minted now? Because we, of course, have COVID, so we were just. Great, I'm glad COVID's over so we can do it face to face, eyeball to eyeball. Great to meet you.
They call me Whiskers, you know, I'm worried. Yeah, they know, right? They do. Yes, sir. That's that.
Yes, I mean, I was both of those.
I think that may be
Homelessness.
Oh, right now.
Okay, I'm holding him through. No, they know he's the one with the yeah, yeah, yeah.
They're gonna do it. Be done. No, I think it's. Yeah.
Story of my life.
Mine too.
Yeah. Your brain, I feel like, yeah, your brain.
Mine too.
Yeah. And then I feel like it's, something's hurts or they do. I find and number one. Yeah. And I'm constantly working. That's it. I'm gonna go where somehow. So we try to bring it. Oh, actually. And so weird. Sleeping starts just takes long. Oh, it's the, I think. Things don't get the blood out. It's terrible. Also, it's right.
Renee, can you start recording?
Okay, good afternoon, everybody. I apologize for the bit of a late start. That's on me. Next up, we have Alan Trent talking about the lease revenue fund.
Good afternoon, everyone. Sounds good?
Yep.
Oh, sorry. Okay. Is that better? Well, good afternoon. Hope everyone have a good lunch and welcome back. Always good to go after lunch because supposedly people don't pay attention. But this group here has been very attentive to all the topic, all the subject, and so I look forward to sharing some information with you. Next slide, please. So the board asked us to share some information on the lease revenue expenditure and the process of withdrawing. So the process of utilization of the lease revenue and then the expenditure to date and what we have planned for the upcoming months and upcoming years, utilizing that funding. Okay, next slide. So lease revenue expenditure and the process of utilizing it. Upfront, right now, the balance we have available is roughly about 6.5 million in lease revenue. And on an annual basis, we average bringing in about 1.5 million for lease revenue. And my office is charged with managing the account for the lease revenue and the expenditure of that, any contract execution that utilizing that funds. Now, with the lease revenue, also want to clarify that we combine that into the restitution money that we receive also from the court case he leaves in 2019. So both of those are combined into the same account. And collectively, we call them the lease revenue expenditure. And so with the revenue, what governs the expenditure of it is the West LA Leasing Act in addition to the West LA Improvement Act. And you see there, it provides some guidelines in terms of using that revenue to support construction, maintenance, and services, also renovating, maintaining land and facility, carry out minor construction, although it's helpful to have that there, but minor construction, as you know, could be very expensive. And so we haven't really dived into that. And the last thing is carrying out community operation at the West LA campus to support development, emergency shelter, and supportive housing. So between supporting construction, maintenance services, and carrying out community operation, development, emergency shelter, et cetera, so far up to date, the majority of the funds that we expended has been to support CTRS in standing it up and also bringing in utility infrastructure. And I'll cover that a little more in detail in future slides. But the process in terms of how we determine the uses of that funds, first of all, veterans feedback, whether it's directly through our office or whether it's through this board here or through other services within the healthcare system, the feedbacks received and our team received that feedback. And we would work with the department chief to then, the respective department chief that brings to us the ideas of the project to then develop the concept of that project. And once that concept is developed, we then present it to the executive leadership team to then determine and make decision, if you will, on whether to approve that project to go forward or not. And what we're looking in subsequent year too is we have now the SCIP committee, and SCIP is Strategic Capital Investment Process. Is a committee that we have here that we look at NRM, all the non-recurrent maintenance construction projects, but also this would fall into that too, of future projects that we have developed concept of, the SCIP committee potentially could be looking at that as well. And also other projects that are more closely related to housing development and on the campus, we hope to then present it to this board here through various engagement, monthly information exchange, et cetera, to get the board's feedback on the projects and even ideas on how to further develop it before projects gets approved and contracts executed to move this project forward. Next slide, please. So this slide here is a summary of what we've expended so far. So the revenue and the ability to use those revenues recently, or we were able to tap into that funding in 2021. And so with that, immediately it coincided with the ramping up of CTRS, getting veterans into CTRS. We have to do a lot of utility work, paving, and also bringing in electrical utilities to the site to stand up the CTRS and bring in the tiny shelter. So while the tiny shelter is not paid for by the VA through lease revenue, but the infrastructure to have the tiny shelter, that's our commitment to have that available so that community partners can then donate the shelter. Another major expenditure that we're tracking and we're using the lease revenue for is accessibility improvements for CTRS. There's one project on here that outside of CTRS is actually improvement of all the sidewalk along the DOM, the COC, and surrounding building 500 here, where we have a lot of veterans come in for healthcare. That project there is a prime example of how the process of utilizing the lease expenditure work, where we receive veterans feedback in terms of accessing building 500 through sidewalk, bumpy sidewalk, or the DOM or the COC where veterans reside there and move about and have challenges in doing so. So that's the feedback that the team received, and it was brought to us by our quality management chief. So then with that, our team worked with the various group, the DOM, COC, and quality management to then develop the project, leads to awarding a contract to do the improvement of accessibility.
Alan, is it fair to say none of these are recurring?
None of these are recurring.
Oh, I'm sorry, John Hopper. Okay, you said none of these are recurring costs, is that?
Correct.
Okay, thanks.
Oh, I'm sorry, when you say non-recurring, are you referring to the accessibility, the utility projects? There are some recurring, my apologies, the recurring costs. For example, the janitorial services. Those are a continued need. And a security guard station, if we were to expand the site or have a need to add more security, those are the things that we would add to. So, example, we walked through the site this morning, and there's a lot of excitement in terms of getting more services to CPRS, more staff, and John also mentioned having additional SSBF staff potentially being there, and also community partners, the different services, legal clinic, example, to be at the site. With that, potentially we would put additional administrative trailer there so that those individuals or services have a place to provide the service to veterans there.
So the utilities are just utility infrastructure, is that?
Yes, sir. Next slide. So here, this slide here is more detail of what the expenditure are, the different projects, what we spent on so far. And as I pointed out earlier, the sidewalk improvement, accessibility improvement, that's the one project from this list here that is not CTRS. The rest of it has been, the focus is with CTRS and getting CTRS in place. Next slide. So these revenue expenditure status and the plan. I mentioned earlier roughly about 6.5 million left as balance, and right now the immediate projects in front of us is with the recent fire at CTRS, what our team start to look at and awarded a contract for, and right now it's under construction, a lot of trenching work out there, as you saw this morning, to bring in fire hydrants. Not that there's not enough fire hydrants there now, there are sufficient fire hydrants to support CTRS and the buildings surrounding there. And when the fire department responded to the fire and the subsequent after action report and the report from the fire department, they did confirm that we do have the fire hydrants, 2 fire hydrants out there that supports the area. But we do have the police building that we're going to build in the vicinity. We do have other projects, for example, the permanent water and fire suppression projects that are in the work. And there'll be a lot of trenching work going on. So we try to combine or look at all those projects and utilize the current work that those projects are undergoing and the work that we plan to do to install fire hydrants so that we don't have to trench twice or redo the work. So using that opportunity, we're adding 2 additional fire hydrants near CTRS in the vicinity of parking lot 10. And I wish I have a map or a picture here to show you that, but I can certainly send that to the board and the team here so that you have a better visual. So we're adding the fire hydrants there. And in addition, we're installing bicycle racks and also charging stations for electric bicycles as well. And other projects we're working on and looking at is Continuous improvement on, for safety, security cameras is another one that, we have, in plan. The access road, widening the road, as additional improvement and potentially even perimeter fencing.
Given the fact that this is part of the briefing with the board, I really think, I wish you guys are with me this morning, and I think we need to like look at our, when we're here, taking advantage of you guys also having the ability to get back on the ground, see CTRS, see the improvements of what's going on, because it really crystallizes what he's talking about and why it's so vital. And the best part, to be just to toot our own horn for a second, is to see the wins of how many veterans and the fact that the team is tracking that has moved out of CTRS and into permanent housing. So that as you're looking at this, and yes, it's a lot of money, and I understand that. I'm not really sure where I got feedback. But to see that it's directly impacting our ability to get veterans off the street and into permanent housing, and just the fire in the belly of the folks that are down there. So if in the future, when we come back, I think it'd be wonderful for us to also take the opportunity to see CTRS as well.
Thank you for that, ma'am. And again, it's just similar to back in June when you were here. Prior to that, there's been a lot of briefing, a lot of information on construction, progress construction, but I hope that when you were here in June and had the chance to walk through the site and see the construction, it offers you that clarity or the wow factor that we hope that the board got when you were here. And on future visits, we hope that boots on the ground, go out and walk the site again. Because the site this morning, as the chief and Forrester saw, there's a lot of construction. There's a lot of work. And some may say that if you're tearing up the campus, but as the board mentioned back in June, that's progress. That's what it is.
Mr. Altman, Anthony Altman for the record. A couple of things. One, the chief mentioned the CTRS program, and we see the breakdown of the expenses. Most of it has gone to CTRS, and I mean, I think that this is a great use of the lease revenue fund. I mean, I think in the past I've been very critical of VA's plans to spend lease revenue funds on things that I don't think would have benefited veterans. But clearly, CTRS has an immense benefit, and to that extent, with the Improvement Act, being able to use lease revenue for the purposes of transitional housing, I think is great. But initially, I wanted to touch on something that you had mentioned with regard to the fire incident. Early reporting, local news reporting indicated that it was somehow an issue of fire hydrants. And so I took note, I heard what you said about the fire department report saying that that's just not accurate, that there is sufficient fire safety in the vicinity.
Correct.
Yeah. I think that's important for the board to hear. I think Dr. Braverman's.
So one of the things that happened in this case is that there were reporters monitoring the fire channels, and one of the folks on the scene said, "We need more water over here." So that then got morphed into the fire hydrant was too far away and we couldn't do what we needed to do, which wasn't the case. So there's always misinformation in first reports on things like that. We tried to set the record straight and put information out that we did have a fire inspection in the immediate post events of that. There were no findings that the fire hydrant was, within appropriate distance. That wasn't an impact on the ability to put the fire out. But we still have identified areas where we can improve. We put a couple more on that it's even closer.
Right.
We don't want to have any loss of life or that sort of thing. But that's one of the things that happens is folks make stories out of what they have.
Yeah, and I completely understand that. That's why I just wanted to put my finger on it and say that early news reporting was clearly not accurate. And that happens, right, in reporting. but I think that in the community is what is being repeated.
Absolutely. And the other piece, which you guys are with us today, is the fact that there are structures that are still up that John talked about yesterday that I said, hey, we got to make sure we have a comms plan. They're going to have to come down between now and the 1st of November. And that's going to be a thing, right? Where they're communicating, they're telling them they're going to put together a plan on telling, you know, congressional folks, making sure the media knows. But as a, one of the lessons learned is to also make sure that we keep as much natural flow through the buildings as they're structured. And there's a lot of tarps and there's still, it's much better than it was the last time we were here, but there's still some. So I think also part of the lessons learned for next steps forward to keep it safe and to ensure that, you know, I mean, we can never promise that it's never going to happen again, but to minimize that it travels from one building to the other is to also minimize the structures or some of the tarps and other things in between them.
Yeah, and that all makes sense. So again, I just wanted to pause the conversation and just reiterate that, you know, the early news reporting was maybe not accurate. LAFD, is it the city of LA or the county of LA?
County fire.
County fire, indicated that the fire hydrant thing is just not a legitimate issue.
Correct.
Okay, I think I just can't restate that enough because a lot of people hear that in the community.
Thank you, Andrew. So one other project that I'm particularly excited about is, you know, over the last month and a half, while the rest of the country is, whether it is storm, rain, or whatnot, in California, we have a series of a whole week of like 90 to 100-degree weather. So the feedback we receive from veterans out there is we need ice machine, we need water filtration so we don't have to continually use bottled water. A project that's happening now is bringing in water and gas to support the 2 hygiene trailer, but the water also goes into a separate line going into the 2 dining halls to install ice machine as well as water filtration is in there. And I think I shared with the team this morning too, if there's enough comments and feedback from veterans and staff, potentially if we could even have vending machine out there. So that project right now is actively out there. If you go out there now, you see all kinds of trenching work, pipe being laid, and it's moving forward progressively. Next slide. So here are a number of projects that we have developed concept for, and these are projects, as you can see, the dollar amount is a lot higher, and the intent here again is working with the various team here to develop the concept and present it to the board in different engagement to get your feedback in terms of whether the project is worthy moving forward or not, does it make the appropriate impact or not, and also then present it to our leadership here for approval of the use of expenditure. One of the projects on here that I want to highlight is the renovation of the Wadsworth Theater. Currently, as a healthcare system or on this campus here, we really don't have a facility or a room other than 1281, this one here, to host meeting like this or to host town hall or employee recognitions, a room that's big enough to host a large event. And with veterans moving into 205, 208, future buildings, the theater would be an ideal location for gathering community events and things like that. So I'm hopeful that, you know, with our team developing the concept and share it with board on future engagement and with leadership, get endorsement and recommendation to move forward with that project. It is a high price tag, but prior to COVID, and I think in 2018, 2019, when the board meet out here in LA in person, that's where we host these meetings. And since then, there's roof issues, there's mold issues, and also during COVID, when we shut the building down, some vandalism and all the coppers and everything else been stolen or removed. So now it's at a state where we can't use it anymore, and with a good renovation, I think it will bring back to life, and it'll be a centerpiece until other bigger, better development on campus. So that's one of the projects. And then the Domicile Garden, phase 1 and phase 2, what we have there also, the concepts also making improvements to the courtyard in between the Dom and the community living center, CLC. We often hear from veterans residing in both of those buildings as well as other areas within the healthcare system that there's they want a place where they can walk, they can garden, they can exercise. So those are also a couple of additional projects that we will propose and get the board's feedback and see where it lands.
I just have a couple questions. So you'll have to refresh me. I think you've answered this question before. Lease revenue, I assume, is a particular type of fund or account, holding account. Is it in an interest-bearing account? Let me just lay out the rest of this and you can answer. Is there a strategic process for managing the fund? In other words, a floor for the fund. And can lease revenue funds be used to supplement VA funds for a project, for example, like the CTRS access road, which frankly, I would view that as a VA cost to come from the VA budget and not from the lease revenue. So help me understand that.
So the lease revenues sit in a fund control point that is, first of all, is no year fund, so it doesn't expire. And it sits in a fund control point that's managed by our team here, and is not an interest-bearing account or if you will.
Why is that?
It's part of it. It's just in a government. I don't know if we have the ability to invest the money to earn interest, and if that's something that's permissible, I don't know. And I see Dr. Freeman checking in. So we can't utilize the fund to earn interest and generate funds.
So we do know that we can't do that because
We can't invest government money, so it's considered government money. If it were given to a nonprofit company that we have, so like we do for our research program, where there's an aligned nonprofit company, they have the capability to invest, but only under certain rules that are, low risk, market kind of investments, money market kind of investments. But we're not allowed to take money that's in our funded accounts. That also is the same for the money that we get that's in our general purpose money for, volunteer services and things. To do anything with that money except. At risk. Can't be risk.
and the last question I would have, and then I'll give it over to Anthony, is do you feel like you have enough veteran input as you develop these projects? And are those listed in priority order?
So these are not listed in priority orders. The project that we executed so far, in our opinion, I think we have a lot of input from veterans, and frankly is a combination of improvement for improvement to the environment in the areas where veterans utilize the most, but also to get ahead of any safety issue. For example, the sidewalk is how it was, it's compliance, but it could be better, and those are the feedback that we get from veterans.
Sir, this is Steve Braverman. I think there's two other pieces on here that are important to consider in regards to the prioritization or decision making. So, number one was we wanted to use these funds, or one of the priority criteria, if you will, that we wanted to use these funds for were for things that we thought were necessary for veterans within the scope of the, West LA Leasing Act and the West LA Campus Improvement Act, that Alan showed on a previous slide, that we did not have appropriated funds to do. So when we first started CTRS and anything associated with CTRS, the legal opinions were that we didn't really have appropriated funds to do that. We took advantage of the, in some cases, the emergency for COVID, and then, wanted to use these funds in the event that when the COVID emergency was undone, we still had the capability to continue. We have since gotten more advanced legal opinions with other, law interpretations that allow us to use appropriated funds for some of those costs. The next thing is, and that's why you don't see all of the CTRS expenditures that we had before, moving forward, because some of those we'll be able to do with homeless program office, special purpose funds, and other sorts of things, which wasn't available to us in the past. Right? So we won't be using that again against the lease revenue funds. So that's important. Number two is for those things, and the CTRS access road might be in this category, those things where they don't make the priority list for non-recurrent maintenance or big construction projects in the scope of what we have to do for the healthcare system, but are still important for those operations, like, falling under emergency community care for veterans or what have you. So we could justify that it would be appropriate to use this money for that CTRS access road to enhance the capability to do that community partnered emergency housing. That's one of the sections allowable under the West LA Campus Improvement Act, but that might not make the cut in regards to pushing that against maintenance of underground storage tanks and other things that we have to do, at the facility level, which is competing for the same funds. Over.
I think this is, Anthony Ellen, for the record, one of those times where I have to state that this is my personal opinion. It has nothing to do with the Federal Advisory Committee as a whole, but on the topic of, how do we differentiate these things that should be VA appropriated projects versus, for example, the lease revenue account. And, not to beat a dead horse with the garden, but the garden appears in the VA budget request for fiscal year 22. It's project number 50 in the non-recurring skip list, right? So how does VA then justify saying, we put it as high as 50, which is pretty high compared to all the projects in the VA. How do you justify that?
But again, these are projects that we propose, and it's not projects that we make decisions on already to execute. And the importance of these projects being on here as projects that we put together in concept to further get feedback from this board to move forward on. For the DOM projects, if, like Dr. Brady mentioned, if we were to put it against other projects, NOM non-recurring maintenance type projects that we have for improving different facilities within the healthcare system here to provide healthcare, these projects won't make the list, won't make the cut, if you will. And so these are projects as wish list, if you will, that we are developing and have it available if funding is available, or if we can utilize the lease revenue where we don't have to compete against all the other projects via the SCIP NRM type project.
Sure. And I completely understand that this is not a prioritized list. Yeah, I totally get that. I'm just making the observation is that in this instance, we have a project that is $6.5 million from the lease revenue fund, and something that is ranked priority number 50 in the fiscal year 22 budget, which is pretty high, I think. There's no answer. I think when you further discuss this with the public, I think there needs to be a good sort of understanding of that judgment call. Because to me, it just seems like, well, if it's as high as 50 on the priority list, then, maybe it's not something that we should use the lease revenue fund for. But that's, again, my opinion, and we could talk about that in further discussion.
Dr. Bender.
Alan, can I ask about, Josh Bamberger for the record, the process? Would it be possible to have a group of people, veterans experiencing homelessness, provide advice to the VA here as to how to spend this money?
That's something we certainly could build into the process, but again, a lot of these projects, when we get the feedback from the veterans, so that's how these projects are formed, and to then go back and convene groups, which we potentially could do, will further delay the project. A good example, like I mentioned before, is the water and to the dining facility. That was one ice machine, they want water dispensers, and that was very clear, and we developed that project. So to put the project in concept together and then go back and to the same group that made the original recommendation, we can do that, but I think that's just more time added to the process.
I mean, Josh Bamberger again. I think it certainly can be done in a way that wouldn't slow things down. It's my understanding that people outside of the VA employment can't make direct recommendations that are adhered to, but they can make advice. And I think it would go a long way to showing how these monies, which are specifically to improve the livelihood of veterans experiencing homelessness, is actually being used for that purpose, because people who have the direct impact of that are providing advice. I don't know what the process of that would be, but that feels like it would be a nice direction to go, personally.
Alan, one last question. I'm sorry. Did you maybe answer? Is there a minimum that you'll draw the lease revenue fund down until you get the next investments or next payments and build it back up?
So the average annual revenue, if you will, is about 1.5 million. And when we look at projects, request and analyze the project, I think I covered that in slide 2. It has to fall within the criteria where can we afford it. And every year with 1.5 million, for a long period of time when those revenues were coming in, there's no authority to use it at the time, and so it has been building up now since 2021 with the Improvement Act. We can utilize the funds. That's when we start developing the project. We don't have any criteria at this point in terms of the minimum balance. If I understood your question correctly, we're developing projects to spend the 6.5, and then continue to develop projects to have it on the shelf, have it ready. And again, these projects, when we develop them, could potentially use lease revenue, or when we have good fortune on years where we do have good budget, we have project ready to go. And some of these projects we develop may sit on the shelf and wait.
Any other questions for Alan?
This is my last slide. Next.
I think so.
Yeah. All right, thank you.
Okay, next up we have, okay. You know, just as an editorial comment, I have to say that I think I don't know if you could just ask the question, but you're going to lose the purchasing power of this. Over time. So you're going to continue to get $1.5 million a year. Inflation is going to eat at it. You can buy less, your dollars will do less. It seems to me that there ought to be a provision to have it as an interest-bearing account in U.S. Treasury. I mean, we don't have full faith in this government. There are other accounts. I'm not sorry, I'm funny there. But there are other government accounts that do that. But I shouldn't say other government accounts. Maybe they are nonprofit accounts. But this is another of those special cases. The money is generated by land deeded for the soldiers' home. And so it gives you the leeway, I think, to make some requests.
Keep it still on. Okay. When they're ready. Introduction.
Good afternoon. Can you hear us?
Yes. Yes, we can hear you.
I think you need to mute that. Are you on mute? Muted. Okay. All right, just let us know when to start, and we are here assembled for you. Will you be doing the slides, or will we be doing our own slides?
I am not sure. Just a minute.
Good afternoon, ma'am. This is Eugene again. We will be running your slides.
let you know next slide. Okay, great, thank you. I see that you're advancing our slides for us. I appreciate it. Thank you. Should we start, or is everybody there?
Give us about 2 minutes, please.
Okay, no problem. You just let us know when you're ready.
So
Yeah, right here.
Yeah. You want to give one to Josh? Sorry, it's upside down.
Yeah, you have to just.
And Katz is back in New York, right? Oh, yeah. Up he went.
Up he went.
Cheat sheet.
Ms. Shimkata, you prepared now?
We're ready.
All right, we have Karen on as well, I believe, but not Joshua or Jerry.
I can introduce everybody from DHS when we're ready. All right, should we start?
Gonna let Josh.
This is Josh Bamberger. I just wanted to briefly share with our board why I think your presentation is so important and useful. So for those of you who aren't familiar with Housing for Health, it's one of the preeminent public health systems that provides housing for people experiencing homelessness. They've been working with both Section 8 housing choice vouchers and local operating subsidies to move people from streets to permanent housing very efficiently, providing a breadth of different intensities of services, and sort of, I think what they do better than pretty much anyone in the country is really listening to what each person needs and then tailoring the housing that meets that need, and then using whatever available funding streams there are to get people quickly from the streets into permanent supportive housing. So I asked them to come here today in part to show that even here in Los Angeles, where there is a very tight housing market, using the same tools that are available to the VA, they're able to take a similar population of people living with mental illness, substance use, chronic medical problems, and chronic homelessness, and be able to move them from the streets into housing. So that's why I hope you can tell us a little bit about your experience and successes. Thank you.
Thank you for that introduction, Josh. I really appreciate it. It's been around for about 10 years now, and so I'll do a quick introduction of our DHS team here before we jump in. I'm Lizzie Shimkata. I'm the Deputy Director here at Housing for Health. To my right, I've got Josh Legier, who's an Associate Director here at Housing for Health and manages our Flexible Housing Subsidy Pool Program. We've got Karen Hamilton here, who's also an Associate Director, and she oversees a lot of the housing retention work and the contract management of the ICMS providers that we'll be talking to you about. And we've got our latest person here, Brianna Avery, who is a program manager who will be overseeing a lot of the work with our new collaboration with the VA doing ICMS, Intensive Case Management Services, for those on VASH. Brianna, do you want to come around and just say hello so they can see you? Hi. Okay. So you've got 4 of us here in the room. So we'll start with our history. As I said, we did start in 2012. So this is our 10th year. If you wouldn't mind advancing the slide, please, to the next slide. Thank you. So you have a slide on our history. We did start in 2012. This is our 10th year. We're really excited to be celebrating 10 years really doing this work. We started out as really serving our own population in the Department of Health Services. We had a new director at the time, Dr. Mitchell Katz, who really came in and said, you know, the first thing we need to be able to do is really provide a prescription for housing, and everything else will fall in place. And so that's really from the tenet of that, we've been really changing people's sort of outcomes by being a housing first program and making sure that we can get people into housing as quickly as possible and assessing for those needs as we move along. We provide an integrated service package, and since the sort of beginnings of Measure H, which is our quarter-cent sales tax in LA County, we've really been able to work much more closely with our Department of Mental Health partners, as well as Department of Public Health, to provide that integrated service of case management, specialty mental health care, and substance abuse treatment services, all for a client who needs it whenever they need it. So it's as flexible as possible to be able to get those services wrapped around. If we could advance to the next slide, please. Thank you. So I wanted to just show you the overview of what we do. You know, we really did start out by doing permanent supportive housing, but since then we have grown our continuum of services where we're now doing street-based engagement. We coordinate over 70 different countywide multidisciplinary teams and work incredibly closely with the LA Homeless Services Authority to do that work. So they're deployed all across the county to be able to engage with people and make sure that they're getting the services that they need. We also manage about 2,700 interim housing beds. And for us, interim housing really means stabilization housing as well as recuperative care. Stabilization housing is for somebody who is just needing to get indoors, have some case management services. They're probably having some type of chronic health condition that needs to be managed. We provide 24/7 services. It's around the clock. They are not asked to leave. They basically stay in a bed for as long as they need it. And usually we're working to match them to permanent supportive housing. Our recuperative care program is really a step down for people who are leaving an acute setting and may still need some clinical oversight. So we do have clinical services there where maybe somebody needs a, you know, a dressing change, or they have a wound, maybe they've had an amputation and they're trying to get their healing before they can move on to the next stage of their housing path. I just wanted to highlight, we have also launched a pilot program in some of our recuperative care sites where people can also die with dignity. So we also have a hospice component in some of our recoup care sites where they can also have a hospice care worker. In fact, we have 7 right now who are with 24/7 care, and we do allow people to remain there if that's where they choose to go in order to have a dignified death. So that's also part of our programming. And then our other, the biggest part of our programming around housing anyway is the permanent supportive housing program. We have about 18,000 active clients right now who are either housed or in some process of getting housed. We use our flexible housing subsidy pool as a local rental subsidy for some folks. And then for others, we also have a great relationship with our public housing authority partners where we are working with either Section 8, emergency housing vouchers, or also the continuum of care work. And now we're also working with you all with the VASH program through HACLA and the LACDA. So that's how we do our work. We wrap those intensive services around people, whether it is with a tenant-based resource somewhere in the community or in a project-based setting where it's an apartment building that's been constructed solely for the purpose of housing people who have been experiencing homelessness. And I know I've gone through a lot of this really quickly, but we'll have some time for questions hopefully. But underlying all of this, under the permanent housing program, we also have our homelessness prevention unit. That's a brand new program that we just started, which is really a research study with the California Policy Lab at UCLA. We're really trying to predict and use algorithms to see, if we can catch people before they fall into homelessness. And so with this program, we're really getting a risk list of people who have been using county services and understanding what supports that they need prior to that unit or their housing not being able to be sustainable anymore. So 6 months in advance, a year in advance, if we can step in and try to demonstrate some supports. That's the program we're running right now. It will be a study. I think the study officially will launch in January, and we'll have about 18 months of data that we can collect and be able to demonstrate how far upstream we really need to put these services. I know there's a lot of homeless prevention programs that are housed within the homeless system of care. And to us, that's a little too late, right? So we really need to make sure that we're catching people well in advance of them getting into the homeless system. So that's exciting, and we'll have some learnings from that shortly. And then the other part of our permanent housing program is really the enriched residential care. That's when somebody needs a licensed facility. If they need care and supervision through a licensed facility, typically known as a board and care, that's where we're able to place people as long as that's the client's desire and that's where they'd like to live. Everything is predicated on client choice. But we do have we have about 1,000 people in those types of slots where we're able to pay facility operators to house people in enriched residential care programs. And then if you see on the bottom of the screen, you'll see that we have a benefits advocacy program running through the whole continuum. We have the Countywide Benefits Entitlement Services team, it's called CBEST, where they're able to get people onto SSI, SSDI benefits, as well as CAPI. We are working now also with the Office of Immigrant Affairs, and so they'll also be working to make sure that people can get any immigration issues cleared up, or also then move towards being able to get onto the CAPI benefits. And then underlying all of that, which is the critical backbone of all of this, is the clinical services. We have grown out our clinical services team. We've got our Chief Medical Officer, Dr. Heidi Befaruz, who has oversight over the ERC program, also has oversight in permanent supportive housing, and also provides a lot of support in the interim housing program. So without that clinical support, we really can't do all of this work meaningfully. If you could go to the next slide, please. So I just wanted to highlight our approach. One of the things we really pride ourselves on is, being a housing first program. We really believe in harm reduction. We don't do anything here that's, strict and abstinence based. We're really trying to meet the clients where they are. And one of the things that we really adopted over the years, and in fact, since the beginning, is really a whatever it takes approach. Everybody's different. Everybody has their own history. Everybody has their own story. And we really want to make sure that we're honoring that past and customizing the services and tailoring it for somebody to set them up for success. And so that's one of sort of the secret sauce, if you will, of really making sure that, we have our providers trained and understanding and adopting all of these philosophies. They're all evidence-based practices, and we don't veer from that. And in fact, this year, we're actually launching brand new statements of work, the first time actually in the permanent supportive housing world for us in 10 years, to really actually even do more around harm reduction. The overdose deaths have been incredibly stark here in the homeless system. We see it, we're here in Skid Row actually, and we see it every day. We know about 2 weeks ago, there's a really bad batch of drugs out there, and literally people were dying outside, 5, 6, 7 people a day. So we really want to catch people before it gets to a critical level. So harm reduction is something that's really at top of mind for us right now. We partner with community-based organizations. Just on the permanent housing side of our operations, we have about 75 different organizations that we're contracted with. They do the work, they do heroic work every single day. This is, we have this team plus, a whole bunch of other people here who are doing this work side by side with them, managing those contracts, making sure that we can bust any barriers for them to get into housing faster, to get the clinical services that they need, to be able to braid all this funding so that they can do the work, that they're experts at. We just don't want to have our agencies have to continue to chase after funding and not focus on the clients. So we do the administration and shoulder the burden of contracting with whatever other funding sources are out there. And then we will braid it in and continue to pay our contractors in the most simple form possible. We haven't changed our invoicing systems, even with all the sort of complex funding streams that we've brought in over the last few years. So we do a lot of hands-on technical assistance. You'll come to learn that our team is on calls with providers pretty much every day, maybe sometimes multiple times a day, depending on what crisis is hitting in that particular project. And, we're really here to support the client and also support the agencies that are doing the work. If you wouldn't mind going to the next slide, please. So this just demonstrates sort of the funding sources that we use and the impact that we've been able to create. 10 years ago when we first started, we had one funding source and that was it. And it was pretty simple and we kind of knew what our budget was, but over the years, we've really had to diversify in being able to bring in additional funding just so we can do more of the work. So you'll see that we were able to last year bring in American Rescue Plan dollars. We have Care First dollars that are through the county. We have funding through our Department of Public Health, which is our Department of HIV STD programs. They do a lot of work with us and they funded a lot of flexible housing subsidy pool slots to be able to house the clients that they serve, which are people living with HIV/AIDS. We have a lot of work we do with the Department of Mental Health. They're also a big investor in the Flex Pool. We have funding from the state, which is HDAP and HHAP. So there's a lot of acronyms here. I'll try to break them down best I can. We also have another contract through the state called the Housing for Healthy California grant, which we're working directly with LA Care on that. We have obviously one of our biggest funders is Measure H now. We also do funding with ODR, the Office of Diversion and Reentry. We've also in the past have funding from probation, single adult model, which is again another funding source that came from the Department of Public Social Services. And of course, whole person care, which was our first Medicaid waiver. And now we've moved into CalAIM, which is sort of the second part of that Medicaid waiver that we've been working with. We've been able to house about 6,000 people on our local subsidy, which is the flexible housing subsidy pool. Without that, we wouldn't be able to house people who have legal histories that wouldn't otherwise qualify for federal resources. Excuse me. And also to be able to put people into these enriched residential care type facilities because those facilities do not take federal Section 8 or COC or any other type of federal rental subsidy. So that's been a huge piece for us to be able to be very, very flexible and very quick to be able to house people. Flexible housing subsidy pool can be used in a scattered site setting. So a landlord may accept that if they wish, or we are also able to scale up project-based settings pretty quickly when a developer comes to us and says, this is what I'm building, I just need the rental subsidies. And, up until 2019, we were able to actually do FHSP commitments so that we could help catalyze project-based sites and they could move faster so that they didn't have to wait for a project-based Section 8 award from one of the housing authorities. And so we do work very closely with our housing authority partners to make sure that we're all funding, the various projects that we would want to see come to fruition that would house the most number of people. The funding source really defines the eligibility in our referral pathways. So for example, if the Department of Mental Health has said, here's, we want to fund the flex pool for this much funding, we would use them to be able to get those referrals in and make sure that we're housing the people that they want to house. And so it's always dependent on whoever is providing the funding. The flex pool is flexible, can be used for people in different housing settings. And like I said, we could use it in ERC. We also use it in the interim housing world. It's really just a very, very flexible mechanism for us to be able to meet our people's needs and meet them where they're at. And also for our developers and for, other community members who really want to do this work in a meaningful way and scale it up. With that, I'm going to send it over to Josh, who's going to talk to you more about the flex pool.
Sure. So the flex pool, the initial goal of the flex pool is to bring on a few thousand units as quickly as possible for DHS clients. So we've since scaled up to about 6,000 total units, both in project-based, scatter site, and enriched residential care. The great thing about partnering with Berlin Corners is they're almost like an enhanced housing authority, but they have a tremendous amount of flexibility. So they can do the unit acquisition work, contracting with project-based buildings. They can do it in a very flexible manner because they're not sort of binded by federal HUD rules. So they have a lot more leeway. in their negotiation and their agreements, and their agreements can be much more flexible. They also have dedicated staff that work directly with landlords, with the facility, enriched residential care facilities, and they can act as kind of a care coordination team to mediate any issues that an operator or landlord might have.
Next slide. Can you move that to the next slide, please? Sorry, apologize. We're on to the next slide. Thank you.
So yeah, they have a team of housing coordinators that will work with the landlord and with their ICMS contractors to help resolve any issues with tenancy or any supports they can provide to ICMS, who are the the primary case management service providers. Yeah, and they can also provide temporary financial assistance. So now that we're going to be utilizing Medicaid dollars, we're going to have, I guess, unfortunately, much more prescriptive rules around some of our financial service. But we still will have that flexible piece where if somebody really needs something that Medicaid won't pay for, or some other funding source, Building Corners can step in and provide that to ensure housing stability. So it might be some sort of medical device or just anything that can really help that participant achieve long-term housing stability. Want to go to the next slide, please? So as far as how the FHSP works, Burlington Corners has like a portfolio of project-based and tenant-based units that are available. As participants apply for the FHSP, they are matched to a vacant unit that best meets their preferences. So we're probably not doing as much of that matching as we used to do when we were initially scaling up the FHSP, but we still do dedicate a certain number of units for tenant-based clients, and we are still actively contracting with project-based buildings and possibly expanding ERC. So they're there negotiating, locating units, and we bring them into the portfolio and match clients to those units.
Next slide, please. So maybe Brianna and Karen want to come here, and you guys can take center stage for your presentation. Go right there.
So as Leapy mentioned earlier in the presentation, we just recently partnered with the VA. We are extremely excited about this pilot. It's titled the HUD-VASH CCM pilot. CCM stands for Comprehensive Care Management. So just to give you a little background, so effective January 1, 2020, January 1st, 2021, the National Defense Authorization Act included provisions expanding HUD-VASH eligibility for veterans that have received a discharge designation identified as other than honorable. So similar to the traditional HUD-VASH program, in this model, instead of the VA and the contracted agencies providing the case management and the supportive services, DHS, through our contracted intensive case management supportive services agencies, will provide these services to access the vouchers for the veterans. As of Friday, we did receive 36 referrals from VA, so we're really excited. We officially implemented this program on October 1st. Can you go to the next slide? I'm so sorry. Next slide, please. So the target population have to meet the definition of veteran, must meet the homeless definition, as I stated earlier, have received a discharge designation identified as other than honorable, to meet the definition of low income, cannot be a registered sex offender, and must agree to participate in case management services. And then the next slide, please. Part of our contracted agencies, once the veteran has received the voucher, they will embark on the housing search process. And so as you can see here, it's just a list of some of the housing search roles and responsibilities that we will be expecting our contracted agencies to ensure that once the client or once the veteran has leased up, that those supportive services that we've been explaining to you all along, so that those veterans can stay housed. Like I said, we're excited about this pilot. We've received about 36 veterans that have been deemed eligible for this particular pilot. We are working with 4 contracted ICMS providers that have experience working with VASH, also working with the veteran population. 17 of those 135 have already pretty much leased up at a project-based site. I think Leapy shared the difference between the project-based and the scattered site. And so the balance, which will have TBV or which we call tenant-based vouchers, they will be placed in housing scattered throughout LA County. So again, we are excited. We officially started in this program October 1st. We have been meeting on a monthly basis with all of our partners. So our housing authorities, LACDA, as well as HACLA, and as well as our VA partners. So again, we're excited about this opportunity and we expect for it to be successful. Brianna, who's the program manager that's overseeing this specific project, has experience working with VASH with both at HACLA and the LACDA. So we will open it up for questions and thank you.
Dr. Bedford.
Ben Berger for the record. First of all, thank you very much. Wonderful to see the evolution of this project that I was very aware of 10 years ago. So one big issue that has come up in our committee this last few days is a lot of vacant project-based units that are set aside for veterans, where 1 or 2 buildings are looking at 50 or even 60% of the units being vacant. Have you experienced anything like that in the project-based projects that you have that are funded through Section 8 or Housing Choice Vouchers?
On occasion, sometimes it can depend on, certain eligibility overlays that exist for a certain tranche of units that might be a challenge to match clients to lease up. Like, one thing that comes to mind or something like a 3-bedroom unit or a 2-bedroom unit even, we would have trouble leasing those up efficiently even through CES. So
What would you say is your percentage of vacant units that are in project-based units that you guys control approximately?
Well, because of the size of our portfolio, I don't know if I have a percentage that could come to mind because we have so many projects like leasing up. And then we have a lot of turnover units. So, I mean, we have a healthy percentage in that kind of either lease up or turnover process. The turnover process, the source that we're trying to, match the client from can really dictate the length of vacancy, as well as the eligibility. So sometimes
you don't have folks turning
very
down.
specific on like a spa and trying to get clients from that spa and going through it can take 3 months,
And I would also say that, I don't think we've had anything as high as 60% across the portfolio. What I think we find, and I think also in some of the veteran units that we've seen, because we did support a couple of VHHP units that were constructed and we put in flex pool, where the AMIs were just so low, because we understand that the benefits if a veteran were to get, pretty substantial benefits like 60-70%, I guess 80% service connected, that they just wouldn't be able to meet that AMI because it was so low. I think they were like at 15%. And then, just the additional overlays, also with a disability and also, having to come from a certain place or having this and, when you start, the ADA units, when you start overlaying too many things, even if they're not veteran units, that's when we start calling them unicorn units and we can't fill them, right? Sometimes you need a family of 6 who also has 2 people with disabilities that also has, maybe one of the disabilities has to be HIV/AIDS, and you can't overlay too many things. And that's one of the things we really caution our developer partners to really not go after so much specific funding, even if it's going to take a little bit longer to get the building built. It's not worth it because we're not going to be able to fill all those units with so many specifications.
And sometimes we don't really know the complexity of the eligibility until we're like in the lease up process.
Right.
So that can make the matching even more challenging.
Thanks. So we have, 2,700 HUD VASH vouchers that have been allocated, funded by Congress that haven't been attached to veterans. What would you say if, say, 500 of those vouchers were handed to you guys to house 500 veterans? Do you think you could add them into your system and try to find a way to use your ITM and other processes in connection with community to house them as you have with the initial 36 that you've piloted for people who have other than honorable discharge?
I mean, if they're tenant-based, I mean, we're facing the same challenge that any housing provider in LA is, that we've been successful. And by the way, I used to work for an SSVF contractor years ago and matched a lot of people to VASH and all that. So, I remember we had a lot of success getting folks connected to VASH and seeing them lease up during the veteran surge. And in all the years that we've had success getting folks into housing, they're just you kind of begin to reach a diminished return. So the one thing we really need from our perspective is really more countywide coordination of housing location, because like it doesn't matter how many vouchers we get if we're competing with 3 other entities for a single unit. Someone's going to get it and someone isn't. But if it's more coordinated, that could lead to more success. The other challenge I should note is there's 30,000 HACLA vouchers coming into the system, just regular Section 8. So that's going to be an immense challenge for the whole entire system.
Yeah, I mean, I think that's right what Josh is saying. We don't have the housing stock that we need for the types of subsidies that we're all using. At the end of the day, these are rental subsidies that landlords sometimes will take, sometimes won't. And if there's somebody coming in with 3 times the rent cash, we've heard of stories of open houses where 15 people show up for the 1 unit. And, and they've all got different types of vouchers, right? They might have a Section 8, they might have a VASH, they might have a COC, and everybody's got a rental subsidy, and it just depends on who wins out. And it's become incredibly difficult to do a tenant-based voucher these days.
The success BC has with the flex pool is typically with like landlords that won't take a federal voucher, or now maybe they can't have that posture anymore legally, but in the past that was their success, was getting those landlords that just were like, I won't take a federal voucher, but we'll work with you, or we'll work with rapid rehousing or something. That was sort of like their success. But yeah, as we get more folks in there, where we really are reaching diminished returns.
Thanks. We have a recommendation that the board is going to consider later this afternoon about asking the Secretary of VA to send a letter to the housing authorities to increase the FMR to 175%.
Yeah.
What do you think that would do to the housing market from your perspective?
Well, I mean, I think it's interesting that if we would also need that to have parity for all Section 8s, because I think right now we're already facing the regular Section 8 program doesn't reach. I think VASH is already at 120 or 140% FMR. We're not there, so there's already sort of this disparity between the 2 types of vouchers. So if that's going to be a recommendation, I would ask, just as also a program using similar types of rental subsidies, that go across the board for all homeless programs that are using Section 8. Because otherwise we're just going to end up competing against each other, and we cannibalize whatever we already, have very little of.
I mean, it could help, like if you're just trying to get folks in and not coordinating. But I mean, landlords have just an incredible amount of power in the marketplace right now with everything going on. And there was a story that came out from ProPublica about how they're using algorithms to sort of like flex rents in the same way when you buy an airline ticket. Like, so they're just, no matter what you pay, they find a way to kind of like pump it up even more. So they just have so much power and advantages. It's like we're always trying to play catch up. But I don't know. I mean, I would propose other solutions, more regulatory, but no, there's no, no one, they don't appeal to anybody. But it's just, it's also just a competition from regular market rate renters who are gonna be, be getting out of the single home market or whatever, coming into the rental market. I mean, we don't know. There's so much uncertainty, but I think certainly it will have an effect on lease ups.
Thanks a lot. Mr. Mangano has a question.
Mr. Montano. First of all, thanks for your presentation and thanks, Josh, for arranging to hear this very important program. I can remember when you began 10 years ago and the remarkable success that you were getting by integrating housing with services. A provider could go to this program and get both the money for housing and for services, something they can't do when they go to the federal government. And then this program being replicated in Los Angeles and having a dramatic impact on providers here in the creation of housing. So I really appreciate what was brought into being by Dr. Katz and by Mark Trotz and by continuing with all of you. So thank you so much. I do have some questions that are quantitative in nature, so they can be pretty readily answered. So first question is, of the people that you've placed in permanent housing, something on the order of 18,000, I think, how many first went through your interim housing program? What percentage of all the people you placed in permanent housing went through your interim housing program?
We would have to get that data for you, but I will say we have a much more concerted effort in getting interim housing long stayers into the permanent housing slots that we have since the start of the emergency housing voucher program. So with the start of EHVs last year was really when we were able to prioritize through the coordinated entry system, people who are interim housing long stayers to come into permanent housing slots. So I don't know if that's not a quantity answer for you, but it is something that we are very much looking at and making sure that we continue to do that, so we have throughput in our shelter system.
Totally, I can say, would it be a
75%? Just a rough idea.
Very minimal, like 10%, just because in the CS matching process, they don't prioritize folks that are in shelter. Like it's not a system designed to create flow through shelter in the PSH. So they're matching based, or they were matching based on
score.
About 10%.
So there was no coordination there. So I would say a very small percentage.
I think that's changing now because that's something we have taken up as something that's necessary, because if we don't show the throughput in our shelter system, we're never going to get the people who are in the encampments indoors. So that is going to change. I think we'll see that.
They say it's Senate hearings. I'm so sorry to interrupt you, but we have limited time, so I just wanted to get more questions in. What's the total budget of your program of DHS Housing for Health? What's the total budget?
We're at about 600 million now, maybe a little bit over that.
$600 million. How much of that comes from the city of San Francisco through its behavioral health program?
City of Los Angeles.
But they're in San Francisco. Oh, this is an LA program total? Well, how much comes from LA County?
The majority of our funding comes through Measure H, which is the quarter-cent sales tax. So we get about half of our funding from Measure H. And then all the other funding sources that you saw earlier on the last slide, on the fourth slide, really is a mix of a couple $100 million as well. So that's what really makes up our full budget.
What percentage of your housing is scattered site versus project-based sites?
Scattered site is about 70% and project-based is about 30%.
And Brilliant Corners handles both of those?
Sorry?
Brilliant Corners, your partner, they handle the lease up on both your scattered site and your project base?
No. So if there is a flexible housing subsidy pool, rental subsidy that's been attached to a project-based site, they are involved as far as helping with the lease up by approving applications and doing the housing coordination services. The majority of our funding, though, for rental subsidies comes from federal sources. It's either federal project-based Section 8 or tenant-based Section 8 or continuum of care.
Occasionally, they'll serve a small number of clients that don't have an FHSP subsidy, like if we get funding to support some sort of lease up.
I'm not clear enough, I guess. All the housing placements you do in scattered site and in project base, what percentage of those are done by Brilliant Corners of the placements themselves?
They're not. We contract with 76 different providers to do that work. So Brilliant Corners plays a housing coordination role. They play a role in approving flexible housing subsidy pool applications. They don't actually do the placement themselves. They do housing location services though for a subset of those folks. So we have about 6,000 people who are housed on a flex pool, and the remaining is housed through federal vouchers. So we have 18,000 people, 6,000 housed through flex pool. The remaining 14,000 are from federal sources.
Great. How deep is your flexible housing subsidy pool? How much money is in your flexible housing pool? And I know that it varies, of course, as you give it out, but roughly what's the balance in that account?
$8 million offer?
200 million.
Is 200 million?
It's about 200 million.
200 million.
It's about,
So if
about-
you give a family of $200 million to support that.
all ballpark figures.
Yeah.
These are not like hard and fast. We can get you actuals if you need it.
Oh, of course, it's about. In the contract that you have with Brilliant Corners, is it an outcome-based contract? Is it based on outcomes? Is it based on quantifiable outcomes? How many units, I guess, they find, I guess is what they do for you?
So it's not an outcomes based. We do our contracts for 5-year increments, but they are managed very closely to ensure that they are meeting the terms of our contract and whatever we need at the time. Sometimes we need additional housing location services, and that's what Josh's team would be doing with them. Sometimes we need additional board and care beds, and then they would be going out doing that. So we do change their priorities as our priorities change per the funding that we get.
And so my final question is one of the reasons you want to reduce the number of interim housing units because you are trying to get closer to your goal of a housing first intent? Is that one of the reasons you want to reduce the number of interim?
I don't think we are interested in reducing our interim housing units. I'm not sure where that information came from, but to the extent that we have funding available, we will continue to grow all of our programs, whether it's interim housing, street-based engagement, or permanent housing.
Do you find it to be an anomaly at all that you're dedicated to housing first and you have 2,700 interim housing units?
I mean, we need them to stabilize people if they're incredibly ill, and if we don't have the throughput and we don't have enough units, enough permanent housing units. So we need to have somewhere to have people remain while we can get more units online. So I don't think it's in conflict of housing first. I think it's, an assistive way for us to be able to stabilize people early and to so that they actually don't die on the streets, so we can get them the medical care that they need quickly.
Or if they lose their housing,
Yeah.
it's an exit destination because it takes so long to locate a new unit. So
they can stay.
yeah, we can get somebody into an interim unit. Hopefully.
And quite finally, what's the total budget for your interim housing units?
We'd have to look into that. It's probably about 100 million.
Thank you very much. I appreciate all the good work that you do.
Thank you.
Okay, any other questions? Mr. McConnell and team, thank you very much. We appreciate the information.
Thank you so much. Thank you for having us.
Bye-bye.
Bye-bye.
Okay, I think we have to tee the next speaker up, so just give us a minute or two to do that.
As they said, it's been a hearing.
Bring in my friend and you make.
Complimented you and complimented them. Finished, it ended. Finished with, I didn't like the play. That's a lot of money, 600 million. Even in Washington, that's a lot of money.
You can even talk about that in billions.
Yeah, that's not a, that's
More
a
than half a
rounding
billion.
error, that's real money.
I can house everybody in a rounding error in my budget.
You know, I'm so used to thinking of as San Francisco Bay, I was, the entire lens I heard this was San Francisco.
No, we're.
And then they had this ancillary program in
They
LA.
left us behind.
Yeah. And
We
that's my
favored it.
sort of-
Yeah.
Now stuck in all the things.
Yes, exactly.
Oversight.
Right, or racing.
One person going this way. This way. Oh, yeah, everyone.
Doesn't smell like it.
Yeah.
Definitely from Starbucks.
Behavioral health.
No. Here.
Mayor got here.
That's pulling up. I don't play with it.
It's all of us. And we're like, uh-oh,
Maybe home.
with everybody.
Prioritize. Contractors.
Because the bees are fucking crazy there.
No, because there has been,
Yeah.
Who's on that? Stop. Get Chase. Chase, great. Stop.
Officer training.
No, I'm good. We're moving everybody over to single.
That's a good idea.
I've been trying to tell these motherfuckers.
Anthony, all the
That's smart. Bill, are you online, sir?
Sends dog pictures.
Doesn't even matter.
It does.
You can unmute your. Hello, Mr. Elliott, are you online, sir?
Hi, I am. Can you hear me?
We got you on video.
Can you hear me okay?
Yes, we can.
Great.
Jason, hold on just a couple of minutes here. We'll be right with you.
Sure, no problem.
Thank you.
Oh, west. Yeah. Oh, west, yeah. That's one.
Rob. Yeah, he's online. People that don't at the park project.
You do something else? Yeah. Well, thanks. It must be a good thing. That's right. It's important. Yeah, yeah, yeah. Well, I think I made. Yeah. So she's gonna go with secretary. So we're gonna flex it. He just gonna stay on. Good, thanks. Don't tell me this is a number. Yeah.
Mike. You should have it.
Bad idea.
If you keep it, then no one has to keep bringing it to you.
That's fair. But I don't think I'm pretty. Stephanie, you've been here like one day and you're already like.
Good at observation.
You're not shy.
Can't be what you do. Oh, you don't like sweets?
I don't.
Would you like some candy?
No, thank you. That's what's going on.
Okay. Well, let me not give you chocolate.
I don't know.
Thank you.
I almost got the Skittles.
Oh, is that?
Yeah.
Yeah.
He loves Skittles?
Yeah.
How do you know that?
Oh,
That's his thing. That's his thing.
Oh, yeah.
Oh, it is?
Yeah, like that's.
Oh.
I love Skittles too. Also good job. Private share. Private share, he's probably doing that. He's a real fun problem. Oh, lights on, military time. Yeah.
Wow, everyone's.
Refined. I got I think it's a mic.
Very sensitive.
Mike.
Mike's for.
Like fun fair.
I mean, it's not like.
Resources about. Likely.
I don't think WebEx would have a large business.
Yeah.
I mean, I think yesterday, honestly, we get some offer what you're, that's the, but it's more likely something. He's going to do.
I think he's ready.
Go on, refresh. No, you can't hear.
Yeah.
What the heck? I'll check all of them, so we'll check all of them. Let's see.
The kids. How many hands?
Texas. Yeah.
Maybe he'll get a little bit.
So, if we look at, your budget.
Doctors turn me down. Almost every
Because
doctor.
it's because all the color candidates and all this.
Almost every doctor turns me down.
That's fine.
God damn it, Anthony. I got a protein.
For example, in there.
Coffee in it.
Road.
How's that, Stacy?
Yeah. The mayor's lawyer is my lawyer.
Oh. Wait, as a lawyer, or your personal?
Usually he's still with trying to fuck me.
What do you? Well, Talk to Marty Block ever?
Yeah.
What's he doing?
You know, Chris Ward and I are really close. Just former chief.
I didn't know that, but I do know Chris Ward is a council.
No, he's an assembly member.
Oh, is he?
He's the one that I was talking to about the VHHB. I'm like, hey man, go fucking check.
Oh.
That's, we work out 3 days a week together.
You won't remember this, but if you remember this, he interviewed me for my first job ever when I graduated from college. From undergrad, my dad got me an interview with Chris at Marty's office. And Richard Bloom offered me a job first.
Richard Bloom was very upset last week, and Laura Flegman was very upset that Isaac Bryan got in the photo op that President did.
Oh, God. Bloom was in the background. He wants some snacks. I have a lot.
Fucking Russian is over here.
Won't stop. Hey, what's this?
Damn.
No, I know. Don't worry.
Why
I think governor had the emergency.
Yeah, the governor had an emergency? I don't know. Perfect.
Are you avoiding the almond joys?
Yeah.
Me, Keith, and Jason all picked up almond joys, and I just want to say that those are like my soul food for life because of that. Of the lemon almonds.
Honestly,
The best part of
I
it.
just avoid it. But everyone usually call me on it. Not really.
Did you change your Instagram name? Didn't it used to be Los Almonds?
I still.
Oh, you are?
Why?
Sometimes I get confused if it's currently Los Almonds or if it is. I guess it's always been that song.
I think before it was all man.
Yeah.
And I was like, grammatically, that doesn't make any sense.
It's your name.
Yeah, but when it's singular and the other is plural. So if it was L all man, that would make sense.
Hello, can you hear me?
HVAC just still.
You go to that greenhouse, Kate?
No, no. I went to bed. Like that. Everybody go hang out with that.
Go with Chase.
Whatever you want.
Great, thank you.
Maybe, I don't think so.
Okay.
She brought up the Russian war in Ukraine.
I mean, I think that, you know.
Practically, I didn't see the problem.
So you're a veteran?
Two-tier pricing.
I didn't touch it. I caught that lady come in like empty as bar. There's no reason for her to say anything. There was no reason for her to do that.
Well, I mean, if you were the only person there.
Maybe.
So.
Yep.
Yep. There you go. There you go. There you go. 18 feet.
View the California State presentation. So while she's completing the call with the secretary, we're going to skip ahead and do recommendation 18-2. 18-2. I think we've got all the voting members in place. I will ask Dr. Bamberger to
I don't think they
to introduce / read the recommendation.
I'm a voting member, but.
For the record, thank you very much, General. We are, the Services Subcommittee, which pulled this together very quickly last night, wants to present VCOEB recommendation 1802. Oh.
Mr. Elliott, are you still on the line?
He is for sure.
Hi, are you asking for me?
Yes, sir.
Hi, I'm here.
The chief just walked back in, so we're going to relay that last order from the general, and we'll follow the order from the colonel.
There you go. He doesn't know what you're talking about.
You might.
Not a military guy, clearly.
I was on with the secretary, otherwise you could. No worries, no worries.
That's fucking stressful. It was a stressful hour or so.
Oh, great.
Not like that.
Get a little DSL at that, I think.
Screen view, full screen.
Yeah.
Jesus.
Double click on that. See what happens.
Okay, now that we're all gathered together again, we'll proceed with Mr. Elliott's presentation from the state of California. the governor's office, and I'll ask Mr. Mangiano to introduce. Jason, you are with us, right? You can hear?
I am. Hello, I can see you.
Even more amazing. So Jason Elliott is the senior counselor to Governor Newsom on a variety of different issues in California. And part of that portfolio is the issue of homelessness. And as a result of that, he's been involved in the creation of policy and the implementation of that policy throughout California. And a major piece of that policy, of course, is the governor's initiative on Home Key, which is in the process of creating thousands of units. And by the next few years, it will be tens of thousands of units. And so Jason is the person who is in the governor's office, specific on the issue of homelessness, and has responsibilities related to Home Key. In that capacity, he's here with us today. So Jason, thanks so much for being here, and we look forward to your talking to us. Thank you.
Thanks very much, Philip, and welcome to California, everyone. I always, wonder how it is to be introduced as the person responsible for homelessness in California, because clearly we've got a long way to go. But I think we've managed to make some serious progress in the last couple of years, and that's in no small part due to the federal investments that we received, not only through the various stimulus bills, but also from your sister agency FEMA, that was so important in implementing Project Room Key, which was our non-congregate sheltering model. We've sheltered over 60,000 unduplicated people experiencing homelessness since the beginning of the pandemic, just with Project Room Key, which was a partnership with FEMA, a partnership that I should mention began during the Trump administration. So just a tremendous success, and nobody cares because the problem feels worse. But I know that those 60,000 people care, and in a much smaller point, but I think apropos for the audience that I'm privileged to be in front of today, what your secretary was able to do on San Vicente Boulevard, which was an encampment that vexed a lot of people for a long time, my boss included. It was a bugaboo of his. And my God, we could not make progress. And your boss came down, Madam Chief of Staff, it's a pleasure to meet you. Your boss came down and oh, what happened? Oh, there we go.
I want to say hello and great to meet you as well.
Hey. And your boss came down and did something about it. And in the timeline of government, that thing moved at light speed. And I think maybe I'm getting the number a little bit wrong, but something like 110 veterans, men and women, were moved out of unsafe tents and into safer areas on the campus, and were able to receive services. And that's a tremendous testament to the team there at that campus, but also to the federal leadership. And I just say that because we're toiling away over here, and we're California, so we're kind of big. But when the federal government chooses to be involved, and to be involved in a focused way, the warmth of that light and attention makes a really big difference for us. Even a place as big as California, we can't do it without you. And this is a conversation that we're consistently having with your peers at HUD, for example. And I don't know if there are any HUD representatives in the room, but want to deeply appreciate Secretary Fudge's partnership on all these efforts too. But I think, just to sort of zoom into, I'm not one who's really here for a whole lot of platitudes. I wanted to sort of put something on the table that I hope that we can continue to work on. This is not a new idea, but we have the Home Key project. And if you're not familiar with the Home Key project, it's basically just adaptive reuse with a whole bunch of bells and whistles put around it. So we're looking at hotels and motels and vacant college dorms. And, there was one implementation in Santa Barbara County that I love. It was a city office building, and the city wasn't sending workers to the office building because of COVID. And so that city, Lompoc, they turned that office building into something, a couple dozen units for people exiting homelessness. So it's adaptive reuse. It's adaptive reuse to create homeless housing. And, Governor Newsom didn't invent the concept of adaptive reuse, but I will, perhaps at the risk of congratulating my own boss, which is at peril any of us political appointees do this, put it at scale. We're $3.75 billion into a home key program, what we call home key program now in California. We've created 12,500 units. Those are not like in design or in construction. These are, because it's adaptive reuse, it's quick turnovers. These are units that are now serving people experiencing formerly people experiencing homelessness. It's a massively successful program. The Biden administration, we've worked closely with some of your colleagues at the White House on how to take some of this to scale through various presidents' budgets and so forth. And so I think it's a great program. And I think one of the things, we didn't invent adaptive reuse, but what we did do, which was an innovation, was waive everything. I mean, California is historically, we get in our own way when it comes to these sorts of things. And with Home Key, we waived all underlying local land use and zoning, and we offered a CEQA, our version of NEPA, a CEQA exemption for all Home Key projects. The speed is what made Home Key successful. With different audiences that are less sophisticated, I'll brag about taking, adaptive reuse and converting hotels and motels, but that's not a new idea. The new idea was the streamlining, and it's worked. So, we had an idea a while ago, and we've been working with the VA on this around combining VASH and Home Key. So, and this is what I want to sort of, Madam Chief, kind of put on the table, and it's something that we're already doing and our staffs are already partnering on. So this isn't a brand new pivot, but I want to really see if we can take this to scale at the secretary and the governor's level. So very basically on Home Key, if you're not familiar, we fund individual projects that counties and continuums of care bring to us. So we don't pick projects. The County of Los Angeles, the Santa Barbara Continuum of Care will bring say, we want to buy that hotel on that street corner, and here's the price. We do our due diligence, and if it passes muster, we fund the acquisition. Then what the local government does with that is largely their own decision, meaning they can choose to serve unaccompanied women or youth or single adults or veterans. That's a programmatic choice that local governments are empowered to make. So we had an idea that is now, not to bury the lead, we've got 9 projects that we're working with the VA on, constituting up to 120 units, where the service subsidy for those hotels or motels or whatever, when they come online, we need to provide the services, obviously, to the individuals. We said, let's project based some VASH, and let's try to make these veterans focused. And it's working. We have 9 projects, 120 units. I got a list of them here, which I'm sure you guys have as well. And if not, I'd be happy to get to you. But it's a partnership that we feel very inspired by, and we think there's a lot more potential to go bigger on this. So I think we're interested in building in homeless veteran population into future NOFAs that we have coming out, so we can actually direct counties to be more intentional about veterans. Right now, it's basically their option, and a number of communities are taking that option, but maybe we should be a little more intentional. So that's a place that we'd like to explore with you. The obvious request is and I admit ignorance on sort of what the secretary controls, but if there is a pot of discretionary vouchers that can be put towards a successful innovation and implementation, we think we have one that's tailor-made. This is not a new concept. We don't have to ideate and get something off the ground that may or may not be successful. This is working. And so if, to the extent, and maybe that you tell me this doesn't exist, but if there is a pot of HUD-VASH vouchers that can be dedicated by the secretaries to something that's working that we want to take to scale, we think Home Key is that partnership. And then I guess I'd be remiss. The final point is, we're just, as we're working towards these implementations, we want to just make sure we stay close with the VA to ensure that there's sufficient support staff to ensure that utilization, to identify the veterans, to get them placed, and then to make sure they're successful with the social service wraparound that they need to be successful once those placements are made. And I know that that's an issue that we're all facing across the board. So not unique, of course, to the VA, but I'd be remiss. I talked to our staff at HCD, which is our HUD, before we convened for this discussion, and this was a point they asked me to raise, so I'd be remiss if I didn't do that. But look, I think the takeaway here is we Home Key is working. As I said, we're $3-something billion into this, 12,000 units into this. It's happening. It's out in the world. This VASH partnership is a budding innovation that we also think is really going to take root, and we hope that we can just continue to build on this, frankly. And look, I'm most focused on California because I work for the governor of California, But to the extent that there are other governors, territorial leaders around the nation that are interested in pursuing this model as well, we'd offer ourselves as a technical assistance model. We can, fly as a visit people, especially if, for example, Hawaii wants to know about this. I'd be happy to volunteer my services in Hawaii. So, you can take me up on that if you ever need to. But I think, we're happy to replicate this around the country, but certainly I'm most focused on getting ours here in California. So, Map Chief, thanks for taking the time to hear us out, and happy to answer any questions.
A second, sorry. Can you hear me now?
I can. Yep.
Great, thank you. Sorry about that. All right, yes, definitely willing to partner, and looking forward to seeing what else we can do. I will say, one of the briefings that I had today is, the Secretary has laid out our goal of 38,000 for this year to house homeless veterans, and we should be at like 28,000. And I'm proud to say we're currently at 30,000. So we're moving in the right direction. But one of LA and San Diego are two areas that we need to do a lot more work on. And so I'm interested, especially in those two areas, on what can we do to help move this forward, to help us house in both of those areas for our veterans. So thank you so much. And since I have you for a second, Jason, I would be remiss. One of the things that's keeping me up late and kind of freaking me out as we're getting ready to have our buildings come up and running is the issue of the disability compensation being too high for the AMI, for them to qualify to go into the buildings that we're going to have on the West Los Angeles campus. And so with that, the challenge is that our 100% disabled veterans will actually make too much money move into the facilities. And so we were wondering, is there any way with the state treasurer over at TCAC to exempt the veteran disability compensation for the income calculations in order for us to be able to take care of our most severely disabled veterans on campus, and so that the developers would still be able to earn the tax credits that they need in order to be viable and to continue to provide the services that they're providing?
I totally understand the question, and I absolutely cannot give you an answer right now, but I promise to look into that issue. And if there's something legislatively we need to do, I'd be happy to work with your team on what's necessary there. So I totally understand the issue. Income disregards, like the road to hell is paved with increasing disability benefits, right? So I think I totally get it, and let me take it upon myself to look into that.
Awesome. I'd really appreciate that consideration, and I just really appreciate your time.
Mr. Mangiano.
So Jason, I know that you mentioned what's already been agreed to and what's being implemented, but there is another round of home key coming out.
Right.
So maybe you could talk a little bit about the parameters of that, because I think that would be the most relevant one in terms of what the chief is talking about. There will be real opportunities, I think, there in terms of the two places, Los Angeles and San Diego. There are probably a few more in California, maybe too.
So thanks. Oh, sorry.
Sorry.
Yeah, so Philip, thanks for that prompt. I referred to it obliquely in what I was saying before. We have a NOFA that's going to be published pretty soon, and under that NOFA, I want to say it's like 800 million, maybe, give or take a couple $100 million between friends. Veterans projects are an eligible use, but so are single adult, so are family homeless projects, so are senior projects, right? And I think we can certainly encourage local communities to bring forward veteran serving projects, but I don't know that they necessarily will on the natural. One way to sort of rig that game would be to suggest that there's a partnership between the VA, HUD, and the state, that if you bring forward a veteran project, there's a subsidy source that wouldn't exist if you're bringing forward a traditional single adult program, for example. So sweeten the pot. And I think that's where I was trying to go a little bit with the idea that if you have discretionary vouchers, and again, maybe my ignorance is showing here that it doesn't work this way, but if you have an innovation fund and you were to put 100 vouchers, 1,000 vouchers, as many as you want towards this, what we could do at HCD is say, hey, we have a partnership with Secretary McDonough. If you come forward with a veteran project, we've got a service subsidy that's available to help your pro forma pencil that you wouldn't otherwise get. And I think you want to watch behavior change, that will change behavior.
Dr. Harris.
Hi, Jason, Keith Harris. We've spoken a couple times.
Hey Keith, how are you? Nice to see you.
Good. How are you? I wanted to address the idea of a kind of a set aside pot of vouchers. We don't, in fact, have that. And set asides have actually been pretty hard to get with HUD over the years, and they've really moved away from that and instead erred on the side of giving PHAs more flexibility locally. However, the state of California has roughly 5,000 or more unused vouchers. Multiple medical centers, including both the ones that the chief mentioned, have 500 plus available vouchers. From my perspective, those could be considered a discretionary pot. Those vouchers are available. They could be set aside for project-based use through home feed. So the means are there. It's just not exactly the same as the way you were describing.
And listen, I'm into outcomes, not tactics, right? So if there are unused vouchers sitting at those medical centers in San Diego and LA specifically, obviously you guys have visibility into that in a way that I don't. And we wanted to partner on this. This is like a multi-party thing, right? Because we'd need the medical center to commit those vouchers to a project. We'd need the local government, be it the county or the continuum of care, to put together an actual proposal. And then we'd need the state to look upon that favorably. I can speak to how we would look upon it favorably, right? But I can't necessarily control those other two inputs. But I think there's a meeting of the minds there that I think would be great to do.
And one other thing I wanted to mention, Keith Harris again. I did a few months ago spoke with Richard Cho, who's senior advisor to Secretary Fudge, and he expressed interest in this as well. So I know HUD is on board.
Yep. Richard and I are texting buddies, so he knows what I'm up to.
Mr. Allman. Anthony Allman for the record. Jason, I don't know if you could see me on camera, but I'm off camera.
I believe that you're there. I can't see you, but I believe that you are there.
I received a phone call this morning from a veteran who is 100% disabled. And this issue has come up frequently over the past couple of days. And we know that there's a barrier for housing eligibility, specifically the AMI, and that's a complication. There was something else that was brought to my attention just this morning. When you mentioned it, I thought, oh, well, that's interesting because I knew that you were on the agenda today. And that's qualifying for CalFresh. So apparently the disability income not only affects a veteran's ability to get housed, but also to feed him or herself. And I don't know if that's an issue that has been brought up in the past. I know you're the homelessness guy, but I'm sure, you've heard of these issues in the past.
Yeah.
And,
So and this source of income that we're talking about, this is state SDI or this is a federal VA?
No, this is federal disability compensation. And so my understanding.
Specific to veterans.
Correct. VA disability compensation. So my understanding is that this would not be considered income or should not be considered income because it's compensation. And I know that obviously the food stamps are administered through the counties. Maybe different counties have different rules. I don't know.
They shouldn't.
Yeah, and I'm definitely not a subject matter expert. I just wanted to relay this individual veteran's experience because I think while we're talking about eligibility for housing, the veteran or anyone for that matter has to be able to eat as well. So it's something.
Yeah, I mean, I wonder. Oh, sorry to interrupt you. I wonder whether the answer to your question relates to the question that the chief asked me as well, which is there a more blanket disregard that we can do for veteran benefits? Look, we've looked legislatively in the past, and I know other states around the country have done this, at disregarding pension income and other sorts of things. So would the disability VA specific veteran specific disability compensation be something that we could just look at across the board as opposed to on housing and on SNAP and on all these individual programs.
Yeah, one uniqueness of the disability is that it's not taxed by the federal government. And
Right.
so I don't know if that gives you kind of a unique opportunity with other pensions that may be taxed or not, but the disability in particular is not taxed. And so just something to consider.
Yeah, listen, I pride myself on being able to kind of BS my way through most policy issues. When it comes to tax law, that is a place I know I cannot play, so I have to go talk to my tax experts on that one.
Completely agreed. I just wanted to give
Yeah,
the difference between the income and the fact that it's taxed and not taxed. And so I
Right.
think that would make it easier for you to differentiate as you're looking at this issue.
I think it does. I think it's pretty
I
clear.
think it does too, but I just wanted to just point that out to you as you're navigating letters. And, you know, we will follow up. I think the best thing to do, Jason, instead of making you the secretary from this meeting, which we will not do, is we'll follow up with the letter to give you information on this and why it's so important.
I got it all.
Okay.
All right. No, I appreciate that. Thank you. And that'll help me unlock some stuff inside our bureaucracy as well. But I wonder whether these two issues are actually one issue, to be honest with you.
I kind of think they're the same issue, it's just different outcomes. But thank you so much. I just appreciate your consideration.
Of course.
Mr. Montgomery.
So one final thing, and I know this is presumptuous on my part, but
He said that before.
we're part of the role of this.
Why we love Philip? Are you kidding me? Come on. That's the whole point.
Part of our role in the VCOEB is to be advocates on behalf of homeless veterans. And that is to advocate for what might be morale inducing, what might bring developers to the table, what might bring service providers, counties to the table on behalf of homeless veterans. So in that light, and I know there's been some discussion about this, the possibility of having the governor and the secretary do a joint press event in California, specifically targeted to veterans. Obviously, the secretary made clear his deep commitment to veterans in terms of the 38,000 nationally and the 1,500 in the Los Angeles area. Obviously, the governor has made his commitment to veterans through a variety of different initiatives, including Home Key. I just think it would be so morale inducing in incenting to people to step up in Home Key specifically to serve homeless veterans. I think that would move the needle in the direction that we want to go in California. And Keith rightly says that there are 5,000 unutilized HUD-VASH vouchers in California that keeps some of those housing authorities from being able to even apply for more because there's a certain threshold. So it would be helpful in any variety of ways, helpful to the secretary, I believe, helpful to the governor, I believe, but also helpful to the housing authorities, provider agencies, this VCOEB group. If something like that could be arranged, something that would spotlight this issue. It might be around one of the Home Key initiatives that's focused on veterans. It might be the secretary coming to do an announcement about the opening of a building. Whichever, it would be just idyllic to think of the governor and the secretary doing an event together.
Well, we've got an election in a couple of weeks, and so I don't know if you're going to want to do an event with a lame duck governor. Maybe we'll win though, and in that case, we're happy to do that. And I think that would be fantastic. I know the governor knows the secretary, appreciates everything he's done back into the previous administration, but also the leadership on San Vicente, which he did not need to weigh into, and he did, and it made a difference. And so I know there's a deep appreciation there. So listen, I'm happy to work on that if that's something that the secretary's office wants to do.
He will definitely be here for the buildings. He's promised me that because I've made that a personal ask. So I get one. So he will be in California once we do the grand opening of one of the buildings or both of the buildings or whatever ceremony we determine with the timeline. So we're still working through that. So I will make sure that you're aware of when he's coming and we go from there.
And I'm just looking at the list. The closest we've got is two Orange County, one in Costa Mesa, and the other I don't know where it is. to Orange County home key. So maybe we do a twofer and you guys do the thing at the building there, and then we can maybe drive down the road to Orange County and visit one of these VASH home key projects and do that too. So that's great. Keep us posted.
He's also the chairman of the USICH right now.
Okay. All the more reason.
And that's an excellent segue, actually, because earlier this week, I was in Cambridge with Jeff, and we were at a convening specifically on behalf of unaccompanied women. And I've had multiple conversations with Jeff on this idea. And of course, he's all for it. He's been a champion on this issue for many, many years. We've known Jeff for a long time. So involved in the USICH, obviously the secretary is the chairperson this year, and the governor, who used to chair the United States Mayor's Conference on Homelessness, actually, that committee of this. So there's all manner of confluence here that we should take advantage of. Thank you.
Very good. Well, Jason, thanks very much. I apologize that our timing got a little bit off, but it was well worth the wait. So we appreciate you hanging with us and all the good information and camaraderie. Thank you.
Thanks very much. Nice to see you all.
Great to meet you.
Rob Beglin.
Good afternoon, all.
I see you. I apologize that our timing got off. Whatever prison cell that is you're in, it's very nice. Yeah, okay, I see the nice face behind that. But we are ready to proceed with discussion and perhaps a vote on recommendation 18-01.
Rob, everyone has a hard copy, so we're not going to put it up on the screen because it's hard to read. Everyone has a hard copy in front of them. So over to you, sir.
Well, good afternoon. Thanks for the introduction. I want you to know I'm actually in a nice hotel room in the Upper East Side, and Manhattan is experiencing a 65 or 70-degree day, and the leaves are still on the trees. But I wish I could have been with all of you today in person. To get to the substance of it, you all will remember that at the last meeting of the board, we got presentations from both the Inspector General's office and from Brentwood School. And the presentation from the Inspector General's office was a review of 2 audit opinions they had prepared, which were required by the West LA Leasing Act, required by Congress. And then we also heard presentations from the Brentwood School on what they were doing to comply with the leasing requirements. And I think coming out of that meeting, there was this consensus that we ought to do more to make the lease comply with federal law. The answer that we were being given by the VA was that the lessee, meaning Brentwood School, was principally benefiting veterans, but the Inspector General was offering this view that seemed to be consistent with federal law, but that's not the way that the test is measured, that the lease itself has to principally benefit veterans. So we've been working as a subcommittee, the master planning subcommittee, to develop a recommendation that tackles that. And Eugene thankfully has submitted hard copies. I will read the recommendation into the record, but just at a high level, what I want the group to know before I do so is that the recommendation borrows from the audit reports done by the Inspector General, and then offers a series of recommendations that would encourage the VA to engage in a 6-month effort to renegotiate the lease with Brentwood, and that if it fails to do that, to seek to terminate it. Okay, so I'll go ahead and read the recommendation into the record. The first recommendation of the Master Planning Subcommittee, VCOEB recommendation 18-1. Whereas the West Los Angeles Leasing Act of 2016, Public Law 114, to 26, charged in subsection G, that the Secretary of Veteran Affairs, quote, shall ensure that each lease carried out under this section is consistent with the draft master plan approved by the Secretary on January 28, 2016, or successor master plans, close quote. Whereas the West Los Angeles Leasing Act charged in subsection J3 that the Inspector General of the Department of Veteran Affairs shall submit a report to the Veteran Affairs Committees and Appropriations Committees of the U.S. Congress, quote, on all leases carried out at the campus and the management by the department of the use of the land at the campus. Whereas on September 28, 2018, the IG's Office of Audits and Evaluations issued a report entitled, quote, VA's Management of Land Use under the West Los Angeles Leasing Act of 2016. Among its conclusions, the IG determined that 11 land use agreements did not comply with the West LA Leasing Act, including the lease to Brentwood School, a private K-12 school. The IG report concluded that the lease to Brentwood School violated federal law in two different respects. The lease was not veteran focused and did not rely upon adequate monetary consideration. And then we include an excerpt from the OIG's audit report, and we attach that as Exhibit A. The fourth recital, whereas on September 29, 2021, the IG's Office of Audits and Evaluations issued a second report entitled VA's Management of Land Use under the West Los Angeles Leasing Act of 2016, 5-year report. This second audit concluded that of the 11 prior leases judged non-compliant in the 2018 audit report, 2 of them remain non-compliant as of the current reporting period. Again, the department's lease with Brentwood School was judged to be in violation of the West LA Leasing Act and federal law for the same reasons as set forth in the first audit report. Whereas in response to the IG's conclusion, the department has argued that the lease with Brentwood School meets the requirements of 2B2 of the West LA Leasing Act by resorting to an interpretation of the act that is not supported by the text, as explained by the Inspector General in the first audit report. And I'm going to just quote that portion of the opinion. During the audit, VA shared its interpretation of Section 2B2 and why it believed the Brentwood School lease complied with those provisions. VA's interpretation does not require the underlying lease to provide services that principally benefit veterans. It just requires the lessee provide services that principally benefit veterans and their families. VA OGC stated, quote, VA can grant leases at West LA for terms of up to 50 years, where the third party provides services that principally benefit veterans and their families, close quote. Therefore, the actual use of the land is secondary to the services received. The language in the Act is clear as to the requirements for leases under Section 2B2 to principally benefit veterans and their families. The Act is also clear that Congress asked the OIG to determine whether leases and land use at West LA complied with the West LA Act, other federal laws relating to leases and land use, and the draft master plan. In essence, as to the Brentwood School, VA is asking the OIG to ignore the clear language of the statute. Whereas the VCOEB is of the opinion that the IG's audit conclusions regarding the illegality of the lease with Brentwood School are correct. 2, the department's assertions to the contrary are misplaced. And 3, given substantial public concern about the fairness and legality of the lease to the Brentwood School, the department's continued failure to address the non-compliant nature of the lease discredits efforts to redevelop the campus consistent with the 2022 master plan. Whereas the department has argued that the consideration provided by Brentwood School meets the requirements of federal law because, according to the department, 40 U.S.C. 1302 and 38 U.S.C. 8122 do not apply. But as pointed out by the OG in the first audit report, This argument is so vaguely asserted that the IG was forced to respond that it is, quote, unclear which tentative statutory interpretation leads to the conclusion that 40 USC 1302 and 38 USC 8112 do not apply to the campus, close quote. Whereas the VCOEB is of the opinion that the, number one, the IG's audit conclusions regarding the inadequacy and illegality of the consideration used for the lease with Brentwood School are correct. Two, the department's assertions to the contrary are misplaced. And three, given substantial public concern about the fairness and legality of the lease to Brentwood School, the failure to pay the minimum required monetary consideration discredits efforts to redevelop the campus consistent with the 2022 master plan. We're winding up and getting to the recommendations. So the 5 recommendations, 18-1-A recommends the Secretary of Veteran Affairs instruct the appropriate offices within the department to enter into a 6-month focused effort to renegotiate the lease with Brentwood School so that the lease, emphasized lease, principally benefit veterans. Recommendation 18-1-Bravo. If the parties are unable to reach agreement on a new lease, that the department provide notice to Brentwood School of its intent to terminate the lease with the end of the current academic school year, which is 2022 to 2023. Recommendation 18-1-C. If Brentwood School opposes the department's right to terminate the lease, that the department initiate a lawsuit in the Central District of California to have a judge determine the legality of doing so. Recommendation 18-1-Delta. The Secretary of Veteran Affairs instruct the West LA VA leadership to meet with the Brentwood School and arrange a payment plan so that Brentwood School can pay all of the monetary consideration that it has failed to pay during the term of its lease since the passage of the West LA Leasing Act. And then recommendation 18-1-Echo. If the Brentwood School opposes the West LA VA leadership's efforts to recoup money due under the lease, that the department initiate a lawsuit in the Central District of California to have a judge determine whether any amounts are due under the lease. So that is the proposed recommendation of the Master Plan Subcommittee.
Okay, thank you, Rob. So this is the way we'll do this. Now, I'd like to get a motion and a second, and then we'll open for discussion.
Go for it.
Motion, discussion. Mr. Alden?
Second. Who seconds?
Second is Dr. Bamberger. Open for discussion. I see 2 flags so far. I think Mr. Van Diver was up first.
Sure, thank you. Look, I think that this recommendation probably feels a long time coming for a lot of the folks that are awaiting housing to come here so they can live, and they've been living on this campus and have been seeing this campus. They feel like, we heard during public comment yesterday just how folks feel about the Brentwood School and this lease. I do think that it's really important that any lease, any use of this land principally benefit veterans, and I think we need to adhere to the letter of the law. So very important with this. I also want to underscore how important it is that veterans not just be in silos and not just be around other veterans. And I think that there's so much land on this campus that housing can't be developed on every piece of it. So if we can find a way to work with the Brentwood School, I'm really hopeful that Brentwood School will come back and understand the position that this board has and that veterans have, and that we will be able to have. Because having this land available for veterans to interact with civilians and others in the LA area, their neighbors, is really important. For me, bridging the gap between the civilian and military communities is really important. So I'm really looking forward to a win-win here. But there's absolutely got to be a way that we figure out how veterans principally benefit from this lease, and And that can mean a lot of different things, including, I hope, a recognition that the Brentwood School, the parents, the kids that go to Brentwood School have a lot of soft power, they have a lot of influence. And it would be great if they could join us arm in arm in the fight to end veterans homelessness and the fight to elevate our veterans community here and lift up the idea that civic engagement is a good. Thank you.
Thank you, Sean. Mr. Allman? Did you have a comment?
Anthony Allman for the record. I've, over the years, have expressed some ideas to Brentwood School with regard to how I think they could be more principally veteran focused with regard to their lease. And, I understand COVID happened, but, we've seen evidence, for example, with other providers doing virtual programs that serve veterans through the COVID period. And I want to remind everyone, with regard to the lease, what the obligations were. So for example, it's $850,000 a year rental payment to VA, which goes to the lease revenue fund. But also approximately $918,000 in-kind services. And if you look at the OIG report, it breaks that down. So for example, almost $171,000 to maintain the athletic fields, $348,000 to repair physical structures, $223,000 for staffing, $2,500 for athletic equipment, $45,000 for special events, almost $82,458 for transportation, $99,228 for athletic and educational programs, and $164,000 for scholarships. And I just don't think we're getting that kind of value. And so for that reason, I support renegotiating the lease. And I just want to make a broader point. I'm not opposed to leaseholders on the campus. I think that there are values, that there is value to derive from not only the enhanced use leases, but leases under Section 2B2 of the Leasing Act to include Section 2B3 UCLA. But in this particular case, with the lease with Brentwood School, I think VA can do better. The lease was renegotiated in 2016. I think that there has been enough time to determine whether or not the lease is providing enough value, and I just don't think it's there. But it could be. Again, I just want to state for the record, I'm not opposed to Brentwood School being a leasee on the campus. I am opposed to this lease, and I hope VA will consider the recommendation.
Thank you, Anthony. Other comments? Mr. Mangano.
So I do get the stick in this recommendation. I do get, it's a strong stick. I think that's good. I guess I don't see the carrot here in terms of some of the verbiage that Sean utilized in terms of inducing Brentwood School, because I agree with Mr. Allman that we do. Why wouldn't we want to have the Brentwood School if it's paying that and maybe more? And I think the point that Sean made about the integration of veterans with other populations, I think those are worthy goals. And I do think this is a strong recommendation. My recommendation to the recommendation would be that there be a bit more of the carrot and more of what Sean was talking about in terms of the integration, how important we see that, and how valuable that would be, how valuable the land would be. So I don't know if the carrots failed, and that's why it's not here, and this has to be pretty stringent, pretty lawyerly, pretty tough, actually. So if the carrot has failed, it's failed, but I just don't see any carrot in here.
Mr. Van Diven.
That's an excellent point. This is Sean Gator. Vice Chairman Gano, I think that's an excellent point. I also think that this has been an ongoing conversation, and I will never forget my very first meeting, my very first in-person meeting, last time we were in this room, and how watching their presentation made me feel, as a veteran and as somebody that kind of runs around land use a little bit. And I felt like we were being, I felt like it was a very disingenuous presentation. So, I mean, from my perspective, and I'm sure from the perspective of the veterans that are from the LA region, they've had a lot of carrots, and the carrot is the land. The carrot is you don't have to go and move your facility, and we want to welcome them, but we want to welcome them. We have a responsibility. We perhaps don't have a fiduciary responsibility here as an advisory board, but we do have a responsibility to make sure that the voices of folks who are looking to us to stand up for them are heard. And I think that the carrot is we're willing to hear anything. We're hopeful that this will go over to the VA and they'll take it and negotiate and get a good deal, but it's gotta be more than a few box lunches and a couple houses. Like, we did a calculation last time about how many of the tiny homes would be covered, like how many kids' tuition of the Brentwood school would take to cover the tiny homes. So we don't want to pit kids against homeless veterans, right? That's terrible. And we're not going to do that. But what we are going to do is make sure that this land is that the value that this land represents is amenable for everybody.
Dr. Welch.
This is Mark Welch, and I'm very in favor of this resolution, completely in favor of this resolution. I am a former parent of a former student. My son went to that school, and my experience was they totally disregarded the VA as a portion of their property. And I don't believe they will ever acquiesce to what we need, which is be adequately reimbursed for what they're using. I strongly urge that we adopt this.
For the record, because Doctor, you barely say anything here. So can you just read just your background?
I'm a veteran, I'm a doctor.
Ms. Cohen, is that?
That's Sean again.
I'll make one quick point. I think that I think we need to say out loud, even though I think it's implied here, is that the funding that they're talking about, that Anthony was talking about in there, that's like facilities and sports equipment and stuff like that, is, I imagine, principally benefiting them, and they're trying to pass off as principally benefiting us. That crap has got to be off the table. I don't, like, throw my phone in the ocean. Like, I can't believe that they would try to pass off the funding that for their site that, you know, does not principally benefit veterans as part of the benefit. And I'll stop talking.
I don't disagree. I don't disagree that this is a worthy objective. I remember when we first had the stakeholders on this campus, the people who leased the land, this was maybe our third meeting. And it was, as Sean characterized it, the disingenuousness of the presentations was, you know, stifling. Took all the oxygen out of the room. I agree with that. But I think in a contract, and that's ultimately what you're talking about a contract, each side benefits from a contract. And so throwing some of that into this mix, you know, how they benefit from this, I do think that would be helpful. Otherwise, I'm in support of it. I just think it could be it could demonstrate the value that they would receive and deem more amenable and less disingenuous.
This is Rob. Let me tackle Phil's comment if I can, because I think it's a fair concern. And when we as a subcommittee talked about the recommendation, the consensus we came to is that after we make this recommendation to the secretary, we ought to reach out to the Brentwood School through an information exchange and express a lot of the sentiments you're expressing, and perhaps even offer some ideas. I mean, I've offered an idea in the past on how you could reconfigure the lease, make capital improvements so that those athletic facilities would be very accessible to the veterans on the campus. So I think the place to do that, Philip, is in an outreach, possibly through an information exchange with Brentwood. I just have, kind of two strategic points. The first is ultimately this is a recommendation of the Secretary of the VA. And I think we have to tailor it to him. We can't try to second guess audiences. There's going to be a bunch of people within the VA, including the Office of General Counsel, who are going to have to decide if they're prepared to swallow this recommendation. Because they did not want to swallow the IG's audit opinion. So I wouldn't underestimate the importance of that first piece of work. So I think we ought to keep it as it is. The other thing that's strategic is, of course, there were 11 land use agreements that were non-compliant when the West LA Leasing Act came into existence. And now only 2 are judged to be non-compliant. So, Brentwood had several years to try to do something differently. And last fall, we got this opinion that not enough had changed. So I think the framework we've set up is the right one. But I'm definitely sympathetic to the concern. We need to make sure they understand we'd like to see if there's a deal to be made. And I think that's something we can communicate separately.
Flag up there, Mr. Earl. No. Other comments? Discussion. I'll make just one last comment before we get to the vote. I very much appreciate the points made by all of those who had a chance to talk here, from the chair of the subcommittee to our vice chair and to our members. I appreciate those. I think we're absolutely on the right track here. It's not as if this just happened yesterday. It's been around for a while. The presentation that's mentioned by Mr. Van Diver was disconcerting, to say the least, and certainly did not leave any hope, really, that Brentwood would ever take the initiative to say, hey, let's make this a little bit better. We'll come in and chat and talk about what we can do. I have no view that that's going to happen without a strong push like our recommendation. So I think we've done some good work here. And absent any further discussion, I'm ready to put it to a vote. Seeing none, all in favor say aye. Aye. Opposed? Okay. Unanimous vote for sending this recommendation forward to the secretary. Okay, thank you very much, Rob, and we appreciate again staying with us as we adjusted to do some important things with the schedule.
Of course.
Now, recommendation 18-02, and I see Dr. Bamberger looking around as if he has no clue as to where his recommendation is.
I got the recommendation. I got it.
Dr. Bamberger, for the record.
Recommendation 18-02 addresses the goal to increase the amount of rent that advanced vouchers can support for veterans to move into permanent supportive housing. We came up with this yesterday, so it's not nearly as elegant as my lawyerly colleague in New York. So I apologize if the word is a little bit rough. I'll just read it. Whereas permanent supportive housing is the best solution to end the veterans' homelessness. Whereas VA Greater Los Angeles healthcare system has identified a lack of available tenant-based voucher units as a major bottleneck to moving veterans from homelessness and transitional programs into permanent support housing. Whereas increasing rental payment to landlords would provide further incentive to lease available housing supply to veterans participating in the HUD-VASH program. Whereas in 2017, the District of Columbia Housing Authority approved a housing choice voucher program payment standard increase to 175% of the fair market rent. Whereas in 2018, the District of Columbia Housing Authority Commission approved an additional increase to 187% FMR for fiscal year 2019. And whereas 24 CFR 92.503, quote, payment standard amount and schedule, unquote, authorizes public housing authorities to petition the Assistant Secretary for Public and Indian Housing to increase FMR above 130% threshold. Now, therefore, let it be recommended the Secretary of Veterans Affairs write a letter to the Secretary of Housing and Urban Development, including all 19 local public housing authority agencies in the County of Los Angeles, requesting interagency cooperation to increase maximum rent that can be paid through the HUD-VASH program to at least 175% fair market rate.
Thank you, Dr. Bamberger. Do I have a motion? Do I have a motion? Okay, motion is made by Mr. Allman. I need a second, please.
Second.
Second by Mr. Santana. Discussion. And I thank Jim Curley's flashes up first.
Jim Curley, for the record, I do want to stipulate that this includes the existing vouchers that are in the offer or that haven't been utilized. It's just a question, if they approve this, would that include the vouchers we already have that are unused, or would it just start with the additional vouchers?
Josh Bamberger for the record.
I don't know, do we know if the rent is determined by at the allocation of the vouchers, or is that something that comes later? I don't know the process.
Keith Harris. I don't know the full technical answer to that either. I think, Jim, if you're asking, does this somehow go backwards and raise all the others? No, because the amount that vouchers pay is based on the rent at the time the lease was signed. So it would be going forward and rents would still be individually determined by a landlord. The voucher just pays a portion of it. This just allows the voucher to pay more for that rent than it would have before.
Jim Burley again. I agree with that, with the vouchers that are being utilized, but the ones that aren't being utilized, that are in storage or whatever you want to call them, that would be better.
Yeah, I think it would apply to unused vouchers because they don't really take effect until there's a contract signed.
Thank you. Other comments, Dr. Bamberger.
So I just want to, put out, I'm not going to vote yes or no for this because I feel like it's a conflict of interest for my own other part of my work, which is to advocate for non-veterans to be housed. And it feels like advocating for a two-tiered system where veterans get a higher rate of rent reimbursement than other populations. Feels like I'm working against my own work. That said, I strongly support this committee to creating a statement that veterans should have more rent payment so that they can find ways to benefit from this federal allocation.
But you intend to abstain?
Correct.
Okay, thank you. Mr. Allman.
Anthony Ullman for the record. I just want to say I respect Dr. Bamberger's professional decision to abstain. I think our committee's purpose is to give advice and recommendations to the Secretary of Veteran Affairs, and I would regard him as the chief veteran advocate in the United States. And so I think that the recommendation is appropriate.
Sean?
This is, Sean Van Ever for the record. I think I agree with both you all about this. Veterans already get more than other folks get. And I think through our narrow scope, focused on veterans and focused on the VA, I do think that this is an appropriate recommendation to make, but I wonder if we can't include in there a line about like, whereas friends are, housing is more expensive than this calculation allows for, so it would be the people who are seeking housing need more money to afford rent. And sort of highlighting that the problem doesn't just impact veterans, and then make the recommendation for the letter from the Secretary of VA to specifically around HUD badge vouchers. But I do think it's important we acknowledge that the problem impacts more than just veterans, and that maybe veterans do get more now, but it simply is not enough.
So Sean, before you put the mic away, are you advocating for some sort of algorithm to determine what?
I'm saying that acknowledging that the amount of money that these vouchers cover now is not enough, even notwithstanding that veterans get more than other folks do. So if we can acknowledge that this problem is not just unique to veterans, but from our purpose, where we sit, we're focused only on veterans, I think that answers the mail on both.
Ms. Cohen, I think you're next.
Hi, this is Stephanie Cohen for the record. I have a question. I'm wondering if maybe Ms. Carter or Mr. Harris can answer this. Do we know the distribution of tenant-based versus project-based in LA County?
I do not have that information in front of me. I can get it for you though. I don't know if Keith has it.
So active EBVs are around 11 to 1,200. There's hundreds more in development right now. There's about 2,000 vouchers out of the 8,000 active or set aside. So, no, I'm sorry, that's higher. Stay with first number I shared. That's roughly the distribution then. Do you go on somewhere with that question?
Yeah, do we know approximately how many tenant-based vouchers are unutilized right now? Let me turn this off.
It is, we could get that for you really quickly.
It's in the dashboard.
Yeah, it's over 2,000. And depending on how you're defining unused, it's upwards of 3 months. Sorry, that's my mic.
That's problem.
Okay, I think that was my fault. I have one more comment, sorry. I turned it off because I thought that it was giving feedback from, sometimes when you have too many on.
Thank you for that. I also will abstain, not because of a professional issue. I just don't feel like I know enough about this topic yet to be able to vote on such a recommendation. I think it's important that we do move this forward, though. Veterans do already receive a different payment scale than non-veterans, and I think parity in this county is very important, especially when we talk about how many vacant units there are available, whether they're project-based or tenant-based for veterans right now, and the work that we could be doing within the CERS office to incentivize the units that could be filled. So I will abstain this time, and hopefully we can collectively as a board learn a little bit more about this issue to see where we are on payment scales.
Mr. Montgomery.
Oh, okay, sorry. He was doing this.
I was just muting.
Part of our work on this board is to advocate for homeless veterans and veterans in general. And given that
in the good wisdom of the VA and HUD, they've already made a determination that in other cities, this is an appropriate activity. I wouldn't want, I don't think it's appropriate for us to somehow have a righteous attitude about the inappropriateness of that. The fact is that what we know in those other cities is that when veterans get a higher FMR, it alerts everyone to that. It alerts those who advocate for other populations of homeless people to do their advocacy, to muster their energies to ensure that their population is appropriately cared for. So I think we do a favor to those other populations when we ask for a higher FMR, because you could hardly find a city in the country where the FMR matches against what you need to pay your rent. So I think actually we are favoring other populations of homeless people. We do them a favor in making this request. We alert HUD, we alert the VA to the fact that part of the reason why more developers aren't attracted to providing these resources is they can't make the project pencil. So attracting developers is another one of the advantages of having a higher FMR, bringing people to the table. We have a lot of work left to do. We're talking, 2,000 here. We have a lot more work than that to do in Los Angeles to get the job done. We need all hands on deck. One of the reasons to bring one of the ways to bring more hands on deck is to do something that incents developers to come to the table specifically on behalf of homeless veterans. This recommendation, if implemented, will be a vector toward getting that done. Dr. Bamberger.
Josh Bamberger for the record. It's my interpretation that the 187% FMR is across all housing choice vouchers in Washington, D.C., not just veterans. So this is not great. We do not have a two-tiered system in D.C. What we are recommending here, and I still encourage the board to vote for it, is a two-tiered system. And I agree with you, Philip, that having a push forward to incentivize landlords to get adequate rent payments for their apartments is a way to, and again, we have these 3,000 vouchers that are not being used. We need to use these vouchers. And if this is going to get those vouchers used more effectively, get more veterans off the streets, that is what our task is.
So is there a strategy? Over the years, we've been talking about the issue of unutilized HUD-VASH vouchers that's actually resulted in a substantial reduction of them, either here in Los Angeles or across California or across the nation. I'm unaware of any strategy that's actually had that impact. So I think we may, as usual, have to lead the way here in terms of creative and innovative ideas, which of course couldn't be that creative if it's Detroit and Washington, D.C. Let's face it, I mean, no offense to those august municipalities in our country. And I don't know how they got to the 185% in Washington. Maybe they started with veterans and maybe it went across the populations. We don't know. I do know that it has the impact of creating discussion in terms of what's necessary for any homeless person to achieve housing. That is invaluable to the lives of homeless people in our country.
Mr. Alden.
Oh, you broke it.
Hello, Anthony Allman for the record. Couldn't we already argue that there is a two-tier system, HUD-VASH? I mean, veterans, with respect to the case management resources that are provided by VA, I mean, I don't think that this recommendation creates a two-tier system. I think we already have one. I'm not a services expert, so I'm punting it to you all. I mean, I don't think this recommendation creates something radically new.
I agree with you, but I also want to point out that Build Back Better had gotten passed. If you saw the New York Times article about what did not get passed in the president's budget, included, I forget the exact number, but something like 500,000 new housing choice vouchers for homeless adults that was not passed by Congress. Would there be more reluctance to pass that in the future if the price tag per voucher was higher? I don't know. Certainly can't crystal ball that one, but it didn't happen. But here, does that matter? I don't know. Again, I still think our task is to focus on veterans of Los Angeles. We need to house them. We need to get these vouchers out of the drawer. We need to get people housed. Whatever we can do to do so.
Agreed.
Keith, just for your consideration, Josh, you triggered this for me on the emergency housing vouchers. Those vouchers created a reverse two-tier system relative to HUD-VASH. They came with flexible funding that allows PHAs to incentivize landlords, do landlord mitigation, things that we actually can't do and not do with HUD-VASH funds. So just for your consideration amongst all this, there's a bit of a flipped two-tier right now, anyway.
We want equity. Equity.
Any other comments? I'm tempted to pull this back for more discussion, but I'm not. I think it has merit. I think we speak with the population here. I think it has merit, and I think it speaks for the population that we're convened to fight for. And so we certainly need to use our voice for that. The abstentions, for those that have voiced them, I understand that. But I think our way forward is reasonably clear that veterans need this, and we should advocate. So, any further discussion? Okay, all in favor say aye.
Aye.
Opposed? Abstaining? 2 abstentions.
Blow up quorum there. Did I blow the quorum?
Okay, so the recommendation passes. Keith, did you have something else? Okay. Okay, that brings us to the end of our agenda, and we'll start with the wrap-up work. I know the DFO has some things to say, discuss here briefly, including some parameters for our next meeting. So I'll pass it to you, Keith.
Thank you, sir. So after discussion with the chair, we're going to try to schedule our next meeting in conjunction with one of the building ribbon cutting opening events. One of the buildings, I heard from the developers January timeframe, January, February, so I think it's going to be around January. Yeah. Pardon? So with that said, there's other things that I need from my board members by January, and I'll be reaching out to you. Of course, we have to do our annual special government employee self-certification, annual OG 450. We'll do some ethics trainings online, and then we'll just invite Jeff back to his ACMO VACA 101 training at the outset of our next meeting. Again, we have to have that year's date on the documents. That's why those of you, Amy and Stephanie, that you guys will basically replicate what you've already provided me. It just has to have a 2023 date. And sir, on your behalf, I'd like to thank the following individuals for their support before, during this week's meeting. Okay, from GLA, we have Ms. Christine Mooring, Ms. Fiona Huang, Ms. Rika Brown, and Scott Hathaway back in the booth. ERPI contractor support doing minutes, Nathalie Chavez and Shilpa Desai. And my DFO team, Ms. Janet Elder, Jeff Tennant, who drove up from San Diego, and Mr. Chief Zito. That's all I have, sir. Back over to you.
Thanks very much, DFO. I'm frankly thinking that February is probably a better bet than January for your planning calendars, but we'll see. And in the way of thanks, and I appreciate you doing that, because I think I would have messed those dates up tremendously. You did a good job. Thanks. Special thanks to Chief Badger for being with us. It is so important. It says so much that you and the secretary could devote your time for you coming out, sitting with us, helping us through these discussions, looking at the way ahead, and pumping up the optimism that we're going to get where we intend to be in the coming months. And so we do appreciate that. And I guess it's okay that you drag Mr. Bursler with you. And we're glad to have him as well. John, thank you so much. And he is our daddy, so to speak. So, Dad, we're going to have to talk to you about the number of meetings for this calendar year. Get in a little cheap on the allowance for that. So we'll chat later, perhaps. And to our board members, thank you very much for your attendance and for the quality of these discussions. We're going to need to have some more. I think a couple of things have been put aside to be discussed in our next IPT, and that's going to be important for us to do that and to follow through with that. Dr. Braverman, thank you very much for your participation and staying with us all that time. I know how busy you are, so to give us this time is a bonus for us. Mr. Kuhn, John Kuhn, welcome aboard. We tried to pin every tail on you that we could, and I think we've been semi-successful. So, but we're available to support you as you move forward. And I thank you. And I think that's about it for me, except to wish everybody a safe journey and ask the chief to perhaps send us on our way.
My pleasure. First and foremost, I put these all on your desk, but I didn't tell you what they were. So this is for Veterans Day in Washington, D.C. This is the cover. So you each have a pen of the cover of the program for the Veterans Day ceremony. This is done by committee. All the VSOs put it together, and that's what this is. So if you did not get one or you need more, let me know, and I'm more than happy to get one in the mail for you. But I had enough to go all the way around, so I hope you had yours. This was for my tenure. Now, granted, I've only been here 19 months. This is the best meeting for me personally. The last meeting was the best meeting because I got to walk around and see the progress of the buildings, and so that was wonderful. But what was really meaningful for this particular meeting, John, your presence is amazing. Your energy and the knowledge. I felt like for me it was a master's class. I know a lot of you have been in this space for a really long time. But his presentation to me really made me think and crystallize a lot of things in regards to numbers, that just the ELUs and the way forward in a way that I didn't have before I got here. So I just personally want to say thank you so much for taking the detail, for being here, and just really bringing amazing energy to the team, meeting Maggie, to CTRS, and I just really want to thank you publicly. So I really appreciate everything that you're doing, and I'm seeing it already. I feel it, and I'm really hopeful on the changes. And we've come a long way from the tents on the sidewalk to CTRS. And Dr. Braverman, your leadership is amazing, and I'm so thankful for it. And none of this would have been in the progress that we've made, especially through COVID, without you. So I just think we just need to step back and acknowledge this board and the passion. It is really fun to watch. Sometimes I step in it and I say words like USICH, and then we go down the rabbit hole. I'm just joking. But it's really been, it's as a veteran, you know, I'm a fourth generation. It's personal, and to see the dedication that everyone here takes, the seriousness with the board, I just really appreciate, you know, this isn't hard. You guys have jobs and commitments, and so I don't take any of that for granted. And I appreciate each and every one of you and the dedication that you've brought and the seriousness you've brought to this. And it's personal for you, and it's really apparent. And so thank you so much for your participation, your patience, and your guidance. And I look forward to continue working together. And I just cannot wait till we cut a ribbon and get into those buildings. I'm super excited for that. That is the best holiday gift that I can think of for all of us, and more importantly, our veterans. So safe travels to each and every one of you. I look forward to seeing you either online and in person in the next 3 months or 4 months, depending on how General Hopper runs it. Take care.
Or adjourned.
We have a drive for you.
Yeah.
Well, you're sitting there, right?
Yeah.